Okay, Apurva.
So good evening and pranam to all of you. Greetings from Sexual Medicine Committee Foxy. So my dear friend, today again we are here with the second session of our the masterclass series on psychosexual medicine, psychosexual health. So before we start our program, I would like to invite the person behind all this program, our own chairperson, Dr. Neeraj Jadhav sir, to overview about what all this program is. So welcome sir, and over to you Neeraj sir for your overview and for your blessings.
Thank you, Apurva. So good evening and welcome to this our third series of masterclass series. This series is basically on the psychosexual knowledge about the sexual problems. So basically, we did first two series, one on C2C series, and then one on the confusion to consensus series. But this series is very important because we, as a gynecologist, hardly know about anything about the psychosexual problem. So we have a master in the field of sexual medicine who will teach us about this important aspect about the psychosexual various psychosexual technique which can help us into dealing with our day-to-day practice and which will be very helpful in our practice. So our first session in this series was on communication, which was very well appreciated by everyone. And now this is the second part, and this part is we are going to focus on the sensate focus therapy. We all know that the sensate focus therapy is decade old. It was introduced by Master and Johnson, and it is a very important part in the management of various sexual dysfunction, because what happened in sexual dysfunction, drugs and everything is a very little role. More important is this all various technique about the psychotherapy. So I'm sure that this today's session will help you enormously in your practice, and you as well as I am also very eager to learn about this technique, which will be helpful to us in this field. So once again, I welcome all on behalf of Sexual Medicine Committee and from the Foxy to today's session on the masterclass series on psychosexual health. So happy learning to everyone, and please feel free to ask any question to our expert to solve your doubt. Sir will be very helpful in solving your any question, and he is a teacher par excellence. So take advantage of this opportunity. Thank you, Apurva.
Thank you so much, sir. So, as we know in our culture, whenever you start a good thing, some auspicious thing, we are always taking blessings from our seniors. So today we have a very special guest and really a very dear senior of my guidance to me, Dr. Jaideep Tang sir. So I would like to invite Manish sir to invite and introduce our chief guest for today, Jaideep Tang sir.
Yes. Good evening, everyone. I welcome Dr. Jaideep Tang sir, past Secretary General Foxy and President-elect of the Foxy, a great academician. It is always pleasure to listen to your talk, sir. It is always full of knowledge, and it's on every and very different subjects. So we are really lucky to have you as a chief guest for today's important session on sensate focus. And I request you to share your thoughts on this particular event. Thank you, sir.
Thank you, Manish. I know that everyone will be eagerly waiting to hear Dr. Rao, so I will get out of your way quickly, but not before I congratulate Neeraj for doing such a great job as chair of this sexual medicine committee. I know it's not always the most easy committee to be the chair of, but I know that Neeraj has done a lot of work, and I'm sure that all the work that he has done will be helpful for us gynecologists, who are usually the primary port of call for all women. So congratulations, Neeraj, keep up the good work. And, also thank you and congratulations to Apurva dear old friend, and of course, Manish, thank you very much for putting this program together. I must mention our President, Rishikesh, our Secretary General, Dr. Madhuri, and the Vice President, Asha. And of course, it's an honor to be chief guest alongside guests of honors, Dr. Yashodhara Pradeep Madam, someone again I have known for a very long time, and Dr. Jitendra Sharma, who are both vice presidents of Foxy. I first heard about the term sensate focus when I read a book called The Celestial Bed by Irving Wallace. It's an old novel, 1987 novel, and it speaks about some of the controversies which were there around the techniques of Masters and Johnson, who devised a lot of, produced a lot of literature and devised a lot of techniques. I am looking forward to this presentation from a very eminent faculty, Dr. Rao. And of course, it's a pleasure to see such seniors as Dr. Anil Kaur Madam and Dr. Madan and so many of my friends over here. So congratulations, Neeraj. Well done. Keep it up. And everyone, I'm sure, is looking forward to hearing Dr. Rao speak. Thank you very much again for inviting me.
Thank you. Thank you.
Thank you, sir.
Thank you. Thank you so much, sir. Sir, your blessings are always with us. So thank you. So our the path and always for your guidance. Sir, I think Madhuri ma'am is also there.
Yeah.
Yeah. Is it Madhuri?
Madhuri, can you hear us?
Madhuri ma'am?
No problem. You can just finish with
Okay.
Madam
Okay.
and Jitendra then.
Okay. So now it's the time to get blessings from guest of honors. We have a very, very special guest of honors, two guest of honor for today. One is Dr. Yashodhara Pradeep ma'am. Ma'am doesn't need any introduction. She is like a guardian for us. She is so humble and she is always there for guide us. Ma'am is at present the Vice President Foxy and just immediate past President of Lucknow Obesity Society. So welcome, ma'am. Welcome in this webinar. Over to you, ma'am, for your blessings.
You have to unmute, madam. Yashodhara,
Yeah.
madam, you have to unmute.
Thank you, Apuiva. It's my pleasure to join this master class from the Sexual Medicine Committee Chair, Dr. Neeraj, who is working so hard for this committee. As it has already been said that this committee is not easy and the problems are already existing, but we are not able to bring it out. Now, with your effort, Dr. Neeraj, you could bring it out, and it's a very, very important subject for all. People do not understand, people just talk about the things, sexual activity and all those things, but how important it is and what are the problems in both males and females. So it requires a lot of counseling. So this sensate is a third your master class in the series of this master class, third in the series of the master class, sensate, and it is really very important. But I'm here to hear. I am happy to be seen Dr. Anil Kumar. She is really blessing, madam, to see you today and to meet you on this platform. It was a real blessing.
Thank you.
Dr. Jaideep was a master, as has been said. He can speak on any topic. And I will be falling short in my duty if I do not thank Dr. Rishikesh Pai, the President Foxy, and Dr. Madhuri Patel, General Secretary Foxy, for this. Dr. Madhuri has joined. Namaskar,
Yes,
Dr. Madhuri. And my co-vice president, Dr. Geeten Sharma, who has also joined. And the most learned speaker, Dr. T.S. Rao. So I'm really happy to be there and for the invitation. Thank you so much for this, and I'm looking forward to listen to this. Thank you so much.
Thank you so much, ma'am,
Thank you,
for
ma'am.
your kind blessings and words. And we have our Secretary General, Dr. Madhuri Patel, ma'am. Ma'am, welcome, ma'am. Thank you so much, ma'am, for always being there and always, from your busy schedule, you have always given time to us for your blessings. Madhuri ma'am doesn't need any introduction. Ma'am is the first female Secretary General of our vibrant organization, FOXY. She is in true sense one of the example of women empowerment. So thank you so much, ma'am. Ma'am, over to you for your kind words.
Apurva and Neeraj, thank you very much for inviting me over here. So respected our most dynamic president, Dr. Rishikesh Pai, and who is also very visionary, Dr. Asha Bakshi, then Dr. Neeraj Yadav, who is actively, carrying out so many activities during his tenure. And I think the digital platform has become the best platform to carry out these activities. Then Apurva and Dr. Manisha, they are coordinators and the master of ceremony. Then our today's chief guest, Dr. Jaideep Tang, my dear friend, and I have learned many things from him, and he's a president-elect. Guest of honor, Dr. Yashodhara Pradeep, Dr. Gitendra Sharma, our vice president of POXI. Can you hear me?
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Our vice
Perfectly.
president and today's speaker, Dr. T.S.S. Rao, who is going to speak about the psychosexual health. And I think this is a masterclass series, and this is the second session. I heard Dr. T.S.S. Rao last time, and it was mind blowing. And he doesn't take a lecture like a lecture. He talks, he gives example not only about the patient but other example also. So it becomes very, very interesting thing. And we all should know that there are problems, sexual problem. We should know the women, especially our women, they don't come out, they're the silent sufferer. And now with the education standard has improved, so these are the women as well as the men, they are coming to us with the problem, and we are here to solve their problem. So you will get the best knowledge from Dr. Rao, which will be, we will be, it will be helpful to us in the day-to-day practice to benefit our women. So I thank once again Dr. Neeraj and Dr. Apurva, Rishikesh and Dr. Asha for giving me this opportunity. And I congratulate them for the most apt webinar and wish them best luck for the future endeavor. Thank you once again.
Thank you. Thank you. Thank you so much, ma'am. Thank you so much, ma'am, for your blessings and kind words. So we have again our Vice President in charge, Dr. Asha Bakshi, ma'am. Ma'am is also joined. So again, ma'am is so humble and she is always there and she always get time to join our webinar and giving her blessings. So thank you so much, ma'am, for all the blessings and for giving time to us. And Asha Bakshi, ma'am, doesn't need any introduction. She is at present the Vice President FOXY West Zone, so and our Vice President in charge. So welcome, ma'am, and over to you, ma'am, for your kind words. Asha, ma'am.
Thank you very much, Apurva, for the kind introduction. Thank you very much, Neeraj, for doing such good work. Because if you do good work, that reflects on me, because this committee comes under me. So I'm so proud of you. And truly speaking, lots of things even I don't know what you are teaching. So I think this is going to be beneficial for each and every gynecologist. So today's topics is really a little bit unusual, and I'm sure we will learn a lot. Dr. Madhuri Madam, thank you, Dr. Rishikesh Pai, for having trust on us and letting us do all these programs. And this master class is a wonderful idea, and I'm sure we all are going to have lots to learn from it. Thank you very much.
Thank you so much, ma'am, for your kind words and your blessings. So we have again our guest of honor, a very dear senior of my very dear friend of mine, Dr. Gitendra Sharma sir. And Sarma sir is at present, he is traveling, and still he used to, take the time to come us and giving his blessings. Is really, thank you so much, sir. Sir Gitendra sir is at present the Vice President, Foxy West Zone. So thank you so much, sir. Welcome, sir. Over to you, sir, for your kind words. Gitendra sir.
Good evening, everybody. And at the outset, I would like to thank Dr. Neeraj, Dr. Apurva for giving me this opportunity. Hope I am audible.
Yes,
sir,
yes, you are audible.
Yeah. So for last many years, I am seeing that Neeraj Jadhav particular is doing very good activities in the sexual health committee. And I congratulate him on this occasion as I have become Vice President of Foxy. So I would like to appreciate the activities done by Dr. Neeraj Jadhav. We all know that in our OPDs, we many times we get patients with so many complaints, and being even gynecologists, we don't have proper answers to their queries. So through these kind of webinars on psychosexual health, definitely we will improve the knowledge of our fraternity members, and we will be able to help the all the society members. So once again, I pay my regards to all seniors, Dr. Pai sir, Dr. Madhuri madam, Dr. Jaideep sir, Dr. Yashodhara Pradeep madam, Dr. Asha Bakshi madam, and I once again congratulate Dr. Neeraj for his activity. Thank you very much for inviting me.
Thank you so much, sir. Thank you so much, sir. So after these blessings, now it's the time to start our scientific session, and we have a really very special guest and faculty for today, our very own Dr. TSS Rao sir. I am great fan of his teaching, and himself is an encyclopedia. So I would like to invite my co-moderator, Dr. Manish Mahajan sir. Sir, please introduce the Rao sir and start the scientific session.
So I welcome you all to attend this second class of masterclass series by Dr. TSS Rao sir. TSS Rao sir needs no introduction. He is one of the best teacher in sexual medicine, and he is at JSS Medical College and University Psychiatry Department, Professor and HOD. And we are really lucky to have you, sir, to teach us for this sensate focus technique. Over to you, sir. Without wasting much time, I would like you to start. Thank you.
One minute, I have to make a post. 1 minute.
Yes, sir.
राव सर को बनाना पड़ेगा ना.
Sir's name is seen as this Chinese words. Still, it is seen like that.
Japanese is actually.
That's why it's difficult. Let me. Sir, now your post.
Okay. Good.
You can say.
You can share your presentations.
Able to see?
Yes, yes.
Okay.
Yes, sir.
Okay. At the outset, I'm really sorry that quite a bit of time got lost.
Gopi?
And the confusion was related to the language. It was not picking up. That is one aspect of it. I have become a family member of Foxy for two reasons. One, I am husband of one of the Foxy member, Dr. Vasumati S. Rao, and Dr. Neeraj, and all the people involved in this particular program, Apuva, Manish, too, in fact, all the office bearers. I have become so familiar with them that now I am feeling very comfortable with the whole issue. Before I start, I wanted to give one good news about me, that I have been elected as President-elect for South Asian Societies for Sexual Medicine. The meeting was just about 3 days ago, and I'm really happy that this is my first program in that particular capacity. Thank you very much.
Congratulations.
Congratulations, sir.
Thank you. See, this particular topic, if I am talking to psychiatrists, maybe if I am talking to the sexual medicine specialists, talking to an MBBS group of people, or say other specialists, how actually one should proceed, almost always there will be some issues. If I talk like an expert and in a short period, if I try to convey that it should be done in this particular fashion, hardly anybody will be able to understand the principles involved and why certain steps are actually suggested. This is one of the important. Second, many psychiatrists would be more than happy to talk about major theories that are involved in understanding some of these type of things. If I talk about theories in general, in fact, I will be making the whole presentation so boring that you may not call me for the next session at all. The third point, there are something called as common sense approaches. Any person, any medical doctor or any specialist should be able to handle some of these type of things if keeps some of these aspects in mind. So what I will be talking to is primarily the common sense approach that anybody and anywhere, some of these type of things can be incorporated, not necessarily fully, but to a great extent. The fourth point, many of the times treating men is actually easy because bringing the erection and it takes care of. But unfortunately, we are involved with the two people, one man and one woman. And when we are trying to talk about the female sexuality, issues are something really different. This is what actually I brought out in a little briefer fashion in my last presentation on communication. And we are all well aware that we are from totally different planets. That's what actually the whole psychology speaks. Men are from Mars and women are from Venus, and where is actually the meeting ground? Very difficult to answer. But all said and done, we have to live, and how actually one can proceed. This is the fourth point. The fifth one, what I am trying to do here is actually the sensate focus. What actually the specific steps involved, that will be maybe 1/3 of my last part of the presentation. Before that, I'll be trying to look into why actually this has to be done, and this is necessary in the management of sexual problems. I have heard some of the specialists like urologists and gynecologists and few of the other people. We understand that there is actually a problem in endothelium. You give some medications actually that will take care of it. That was actually one of the school which believes that, in fact, neither we have time, nor patients or the relatives or the partners have that amount of time to visit. So one can have some shortcut and one can proceed. Absolutely. That is actually done for many of the people in many of the clinics. But there are some people who are actually very much interested in getting the proper benefit out of the therapy. And from that particular angle, some amount of training and proper professional scientific knowledge is absolutely necessary. Without that, in fact, we will not be doing the justice. I still remember one of the certificate candidate in our certificate and fellowship program running in the department. One couple was supposed to speak and I was busy with something. He took them there and he spoke to them for about 5 to 10 minutes and came back about 10 minutes later telling that this is the diagnosis and I have completed the sensate focus exercise. Absolutely, that means the person who was telling that particular way doesn't understand what actually we mean by sensate focus exercise. So let us begin our journey. I always believe that learning would be best when things are light, simple, and has some fun attached to it. So from that particular angle, I will be trying to condense it into the simplest possible way, and we'll try to look into what best we can try to understand. Here and there, I have added 1 or 2 videos to make the understanding easy. That way, at any particular point, you can stop me and we'll be more than happy to that particular question we try to answer. First principle, dysfunctions sexual when we are talking about, there are problems involved with sexual response cycle and they cannot be treated in isolation. We are all well aware there is something called desire, there is something called arousal, there is something called orgasm, and it is a process. Whether you talk about linear model or we talk about circular model, that these dysfunctions, many of the times, one of the terminology used is actually what we call as the rainbow phenomenon. What it means is, where one is starting, where one is actually mingling with the other one, it is very difficult to make out. And this is one of the very important point one should remember. The second point, this I have spoken in the last one or other sessions also, that when sildenafil was introduced, people believed that because man can get the erection, all sexual problems are solved. A little while later, maybe at the end of 2 years, around 2,000 plus couples treated in China came out with a study that hardly the situation has changed. So again, we are going back to our earlier situation. Why sexual problems are still persisting with so many new drugs are also available at this particular juncture? This is actually because individuals seen in the context of relationship. Unless we improve the relationship, it is not possible to do it. The whole sensate focus exercises is about actually dealing with the relationship. Without actually looking into the relationship, one would never be able to actually succeed in managing sexual dysfunctions in general. And when we are talking about intensive specific therapies, that this is actually one of the component which actually has to be attended. One important component in that is actually the communication, which we have dealt in detail earlier. So what we'll be trying to look at is actually how actually this particular aspect can be taken in our treatment aspect. Sex is a conversation carried out by another means. That means communication is one of the extremely important component in understanding the whole issue. And what we'll be trying to do, we are going to follow a biopsychosocial model. That means there are some biological issues, there are some psychological and social issues, and that need to be. Whether he is educated very highly, double graduate, double postgraduate, PhD holder, none of those things are going to work. In fact, we have come across people who are actually highly qualified, but hardly have any basic, simple knowledge related to what anatomy and physiology is about. Men to some extent, but women to a great extent, there's a whole lot of problems. They have not seen how actually the genitals look like and what actually the issues related to it. For that reason, people, what they are carrying, the myths and misconceptions, the false expectation, we need to eliminate, and that forms actually what we basically call the another step. Many of the times, actually the performance anxiety is one of the key components which actually will be interfering with the whole process. So that is another aspect that we have to remember. Sensate focus is about actually removing the anxiety, enjoying each and every step. There is actually a process involved. For example, in case of mindfulness therapies, they will ask you to put maybe a grape in the mouth, just hold it there, understand, experience how, in fact, the soft it is and how actually it is actually your feeling and the experience related to it. This is actually, in fact, the process that need to be. That means eliminating anxiety and actually dealing with that. No two couples are same. So individualizing treatment for different couples becomes one of the very important steps in the management. So these are a few introductory lines what I actually wanted to tell you. And we have developed a model wherein, for example, people have ignorance, we correct it by education. Many people have cultural taboos and myths, we try to correct it by permission giving. People have poor communication skills, we teach them by actually training them in correcting the communication skills. Many of the time what happens, one failure leading to another failure, and one of the vicious circle actually set in. So if there is a particular anxiety related to this, how actually one should go, will come 1 minute later. If there is a particular specific precipitating factor present, removing that particular precipitating factor should become one of the things. What I am trying to tell you, somebody may be on certain types of drugs. You talk about very commonly our antidepressants. We are talking about antihypertensives. We are talking about quite a few other drugs, where actually our role comes actually dealing with some of the things. The last step is actually people have lot of aspects related to the success. And many of the times they are in such a hurry that everything should happen in a very short period. And when we are trying to talk about sensate focus, it is a long process. And remember the word process. And this particular process, if we are able to go a little faster, means you'll be actually creating difficulty in the whole therapy. So one is ladder concept. From the least anxiety to the actually the higher anxiety level, we will proceed. The second one is the sensate focus. What it means is each and every sense in our body, and more particularly about touch, will be elaborating in much greater detail. This will be on its own right, may be sufficient in quite a few actually individuals. So this is actually the principle on which. And one of the important points is that ladder concept, what we are trying to talk about, another meaning is there. It should not be stepwise. What it means is one step to the other step, sometimes it could be actually problematic. What is suggested is actually it should be like a ladder, very smoothly one step should mingle with the next step. So this is the concept on which actually this whole sensate focus process of the treatment actually proceeds. We are practicing in Mysore, Bangalore, and nearby patients. And one of the very important aspect in this particular area is actually they're all IT, BT, and computer savvy individuals. They believe that in fact, clicking a button, actually the computer, it should respond. Second, men invariably carry the idea that he is able to get erection means actually the problem is solved to a great extent. And this is one of the reasons. Many people believe that it is actually purely a physical process. Ultimately, they'll end up in missing out on so many actually the very pleasant other related aspects which are associated with the sex. What I just mentioned few minutes earlier in the diagram, ignorance, cultural taboos, and a lot of these things, this Anand mentioned about certain steps. That means we should be able to give permission. It actually can take off their anxiety to a great extent. I still remember long ago, almost about 2.5 decades ago, initially when I started my practice, I was referred one of the case from Shimoga. And I remember when we went into the details, wife was telling, sir, this particular person doesn't want me to close the door. When we went into little detail, he was telling, sir, I am the only son. They have brought up me with so much of love and affection. If I close the door, what they will think? My parents. See, here, the permission giving was just related to the fact that he can close the door, let them think whatever it is and how actually one can proceed. See, it may look like a very simple process, limited information. Some people need little more extra information actually related to this particular aspect. Some people may need some specific suggestions, sex during maybe menses and many other such related aspects, because particularly as the married to a gynecologist, I can tell you, infertility and such related aspects are so much actually dominating the picture, and many people would be. And in a small, minuscule number of people where intensive therapy is called for, that's where actually this whole sensate focus process gets into the picture. We are all well aware how actually we deal with men. But when it comes to women, there are a lot of things we have just not understood for the simple reason that what actually works in case of man, it doesn't work in case of a woman. PDE5 inhibitors are so beautifully used actually in case of men. Hardly it actually matters, and FDA even today, it has not given permission for this whole process. So what we will be trying to look at when we are dealing with sensate focus process understanding, it is a bird's eye view. In the next about 1 hour, what we will be trying to look at is actually some of the key important components and how actually this can be utilized in our day-to-day clinical practice. Okay, so far this particular slide was also focused earlier. We are aware that there is one aspect related to identity. There are a few things what we have already spoken. Sexual function, they are what we call the sexual response cycle, desire, arousal, and orgasm. These are all people came to the conclusion that extremely important. This is what actually Marston Johnson's whole process or theory is about. What was actually understood was that this is purely physiological. And when you are trying to talk about women in particular, or all the people in general, that emotional satisfaction is one which is actually missing. To get into that, that means we need to understand quite a few related aspects. So the personal reflection, those who positively regard sex as something good, beneficial, and important, in fact, who carry positive attitudes, they indulge in frequent sex, and they continue to be actually happy in life for a longer time. Those who carry the very much negative related aspects, who carry significant personal inhibition, hostile and critical attitudes, they will end up with limited sex and a whole lot of issues related to that way. So do remember this word emphasis again and again when you are trying to talk about centered focus, we are talking about emotional satisfaction and issues related to this particular aspect. So elaborating a little further, when you are trying to talk about satisfaction issues related to the drive, motivation, wish, that means all these aspects are extremely important components. So let me look into one or two important areas which actually determine why certain things happen in some particular fashion. One of the important component is actually men can get erection, ejaculation happens, and what happens between the legs and what happens inside the head, what we talk about orgasm, they are so closely linked. Again, I'm going to talk about 1 or 2 minutes later. But somehow when we are trying to talk about female sexuality, there are some people who may be very active and energetically involved in the experiences related to the sexual aspects. But invariably, the literature to our clinical practice talks about the female sexuality is actually primarily inhibitory type. Why this is, we'll try to look into each of these areas. That way, why the sensate focus exercises are necessary in some of the patients. See, this particular diagrams I might have focused earlier also in my presentation. Women always under lock and key. Unless a woman feels comfortable about the relationship, trust is developed. In fact, if she feels happy in this particular relationship, she is not likely to open up. Men, in fact, it is everywhere, everything is actually open. You try to look at in any of the celebrities, these pictures are classically indicators, and anywhere, in fact, it has been documented in very clear fashion, both east or west. Primarily, in fact, woman means it is always under lock and key. When she is willing to open it up, in fact, that's what actually the whole aspects what we are trying to talk about. Whether this is actually found in case of human beings. It is always under lock and key. I still remember there were 2 small puppies. My mother gave little milk and some biscuits. When they grew up, I will lock the door, compound wall, but he will jump and meets 2 or 3 of his girlfriends and comes back. This female dog, you have kept the door open and freedom is available, but still it is inside the compound. This happens not because of anything. Biologically speaking, almost always it is ingrained, whether you talk about psychological, biological, or whatever it is, that under lock and key and little bit of inhibitory activity that is actually documented. So we have to understand what is actually the sex drive. Male is actually testosterone dependent. Orgasm intercourse are inevitably linked, socially acceptable. So one can enjoy lustful and want sex. This is what actually, and upbringing also goes in that favor. Because of this, what precisely happens is men want more sex, have more partners, have more sexual dysfunctions as they age. And when we are trying to talk about female sexuality, intercourse and intense pleasures are not linked. For many, it is difficult to achieve orgasm. Less sexual frustration leading to sentimentality, romance, and many of these type of things, which actually, in fact, many men won't even understand and implement. Traditional societies discourage anything related to the sex as actually something not good. More often, it is a duty than joyous and pleasurable thing, and influence of hormones, which leads to quite a bit of difficulty. So desire for sex more often linked to the relationship status and social norm. This we have to understand why the sensate focus understanding is necessary. At all ages, women are more likely to report sexual dysfunction. So these are the two important points as an introduction, what I can tell you that one should be aware of. And look at the data available. Anywhere and everywhere, it has been documented that at any particular given age, the libido, or what we basically call the sexual involvement, activities.
Rao sir, sorry to interrupt you.
Huh.
Pai sir is here. So, Rishika Pai sir, are you there?
Hello.
Yes, sir. So, our Secretary
sir.
General, I welcome our Secretary General of Foxy, Dr. Rishika Pai sir, to give his blessing. So, welcome, sir, and please, sorry, sir, just.
No problem, no issue.
Yes, I'm sorry about, interrupting and
1 meter, sir.
Okay.
Pai sir?
Hello, can you go ahead or?
Yeah, just wait to 1 minute. Sir is there.
Done.
Pai sir? Hello. Yes, Pai sir.
Can you hear me,
Yes, sir.
Neeraj?
Yes, sir. Yes, sir.
No, I'm just saying that I would like to, first of all, thank you that you have invited me. And it's a very important aspect, that's why we have had this sexual medicine as an important committee of the Foxy, because psychosexual health is very important. And I'm very happy you have been very dynamic as a chairman of this committee and done fantastic work. I think Jaideep Tank and Yashoda Pradeep and Gitendra must be around, and I'm
Madhura
very
madam was
grateful
also
to.
there.
Yeah, I'm Dr. Madhuri is there, and Dr. Rao. Thank you very much for when I was I had finished my MD gynec, I was actually thinking of taking psychosexual medicine also. I was a bit confused at that point in time, and that time Masters and Johnson thing was very hot, and a lot of American institutes were there, with large institutes in the countryside where they used to do treatment. And my dad used to also be in this field. He was basic level, and his student was Prakash Kotari, who started the Department of Sexual Medicine in KM Hospital at point in time. So it's a very important.
Dr. Prakash Kothari is my mentor also.
Yeah, so my father was his mentor. My father was the original. He was from Harvard. He was in family planning, and he started sexual thing in India. Dr. Pai, he got Padma Shri in 1971. But he was more focused on family planning, and Prakash Kotari used to work for him. And my dad used to take a lot of public health lectures, and in one of the things that he used to do was talk on sexual medicine. Now that's how Prakash Kotari got exposed. And then he, of course, became very famous. And dad was, of course, not in that field. But when I became MD, I was confused, and I was at some point in time also thinking of taking the sexual medicine as a field. But anyway, I'm very happy that and sensate focus was at that time very important, and even now it is a very important treatment. And we and Neeraj, we have planned that we will definitely put all these modules on the internet, and so that they can be accessed by from high school to college to even in community, people can access the module, because there's some issue about taboo as
people are very awkward in India when they're talking about sex. So if you give them a platform where they can themselves go and explore that area, they would be much more comfortable. So that's why I talked to Neeraj that at some point we'll launch it. And it is in my mind, Neeraj, one of the presidential initiatives would be to launch this module, which can be accessed by anyone anywhere in India, so that they can have it. See, when there's a person in the picture, then they get awkward to ask the questions and all. So I'm very grateful, and thank you very much, Neeraj, for inviting me here today, and wish you all the best for the program.
Thank you, Prasika sir, for taking time from your busy schedule. Sir is in Delhi till he is there for us. Thank you very much, sir. Yes, sir. Rao, sir.
Okay.
Yeah. Sorry for interrupt.
Oh, okay. No problem. So the point what I was trying to tell, invariably, in fact, there is a little bit of difference between man and woman. And this is one of the reasons why, in fact, people say, I am in love with a girl and I came to know that she is 2 years older. What should I do? I tell them, first you must marry this particular partner, because woman 2 or 4 years older than man appears to actually balance out this particular difference between men and women, what is actually present. Invariably, in fact, in our place, maybe Mandya, what I am talking, marrying maternal uncle or sister's daughter, where wage difference is actually very wide. When he is ready, this girl hardly knows anything about. When she is ready, already the problems have set in the man. So lead to quite a bit of difficulties. Okay, this is one aspect about the drive. The second, we are all have heard this terminology, erogenous zones. See, in case of man, the things are easy to understand because all the tissues are concentrated at one place. So a pharmacological agent or some treatment therapy, maybe electrical too, many other things are actually that are there in vogue now, may be sufficient. But you look at the female, everywhere, any part, some part in some particular person, actually in other areas are actually hardly really marked. So because these erogenous zones are distributed far and wide, it becomes quite difficult for a woman to actually experience. There are few important points which are actually to be kept in mind. This video makes
लड़कियों में प्लेजर पॉइंट कहाँ पड़ेगा? घीस पर जाने का है ना, मैं बता दूं। यहाँ से बिल्कुल सीधा जा, इधर ही है, सीधा आएगा अपना वजीना नगर पे टोल आएगा, उधर ऐसे अपना पर्सनालिटी कंसेंट विंसेंट डेट लेने का, उसके बाद आएगा छोटा लाबिया के, वहाँ पे बहुत संभाल के चलाने का है, बहुत शुक्रिया। फिर फैलोपियन फ्लाईओवर अगर आगे ना, तो तू बहुत आगे निकल गया है, तो वहीं पे गाड़ी घुमा के थोड़ा ऊपर नीचे आगे पीछे that spot right there keep it going, yes, oh yes, मतलब फिर बारिश होगी तो समझ के पहुंच गया। तो वजीना नगर से स्ट्रेट बस ये लड़कों का प्लेजर पॉइंट कहाँ पड़ेगा? मैडम यहाँ से सीधा जाने का एक बिल्डिंग पड़ेगा, एक ही बिल्डिंग, बुर्ज खलीफा टाइप। बिल्डिंग से कहाँ? कहीं नहीं, उधर ही आसपास कहीं भी, कुछ करने का भी नहीं, सिर्फ सोचो, फुल घनाघन बिल्डिंग। Yay! Thank you. I know.
So it is easy. The second important point, why this is, I am spending a little bit of time here is, unless we understand these principles, it is difficult. We mentioned that erogenous zones are distributed far and wide in body in general. But you look at any of the romantic situation, woman closes the eyes. This is one of the very classically documented findings. Anything pleasurable, women close their eyes. You might have noticed in many of the advertisements and other related things. That is because even when you look at the genital erectogenic tissue, it is far and wide distributed, and woman, unless she closes the eyes, concentrates, and free from distraction, it is not possible for her to reach the peak or the orgasm. 100 other things will actually bother her. Whether something to be made in the breakfast in the morning, whether the child's bag is ready or curd is set, or 100 other such other things, which will interfere with her process. But men, in fact, any situation, in fact, the men almost always, they keep the eye open, because jokingly, I almost always say, who is coming next? They have to keep a watch. So man and woman, there is a wide difference between how actually they work out. Brain mechanisms are involved. This is again from sensate focus point of view. Unless we build up the relationship, the things are not going to work. And this particular aspect, the brain mechanisms are extremely important for our understanding. This few of the points I had mentioned earlier, the sexual pursuit, men are very famous in this. Territorial defense, extremely well developed. Alarm system, in fact, amygdala, very well developed in case of male, is actually an executive. The motivation center, in fact, this is one of the reasons why men would be after the female compared to the female after the man. Pain circuit, during intercourse, pleasure and mourning, though this has been actually both the sexes to make action possible. All these things are extremely well developed in case of male. But you look at the female. I'll just remove this particular this thing. Cognitive empathy. In fact, many women come and tell, see, this particular fellow doesn't have understanding what is going on in her mind. He doesn't understand my silence. Our only explanation for them is actually, in fact, man, you forget, in fact, he finds it so difficult understanding the words. If you are expecting your silence is going to make him understand, you are landing up in problem. Men are not made for understanding these things, because I'm going to talk 1 or 2 minutes later when we are talking about sensate means the different senses, how actually it works. You have prepared a nice food and he is eating well. That means your food has been prepared well and he has appreciated. Don't expect him to actually tell you that in specific words that you have prepared very nice food. Many people are very, very poor as far as this is concerned. Social approval and disapproval. Women are so much worried about these aspects, but men very rarely. Emotional empathy. In fact, many of us actually, we husbands get scolded by our wife because we don't have feelings. This is one of the very frequently made complaint. You never loved. Many other such things. Men are very, very poorly actually. In fact, as far as development of emotional understanding capacity is concerned, very poorly. Inhibitory system, prefrontal cortex is very well developed in case of females. And as I was trying to talk about the female functionality in general and the worry wart, even small things. See, for example, a man can close his eyes and imagine 100+ women actually who have come through his life or what he saw in the movie, or maybe fantasize without much difficulty at all. You ask a woman to fantasize, imagining husband wearing the shorts, the pants and lungi, they are not likely to get aroused. I'm going to show another diagram later. In fact, this we have focused a little earlier also, that in fact, it is almost impossible by fantasy, particularly in the Indian context, for the woman to imagine, fantasize, and actually get aroused. It leads to quite a bit of difficulty in that particular area. And when you try to look at a woman's brain, say, for example, amygdala, very poorly developed, we spoke about. But there are few things. Insula, gut feelings, women are extraordinarily well developed. Hormonal symphony. That's why a man finds it very difficult when a woman is actually behaving like a romantic partner to another time, like mother-in-law to mother. Whole lot of queen of emotions. Many men find it very difficult handling this particular process. And more than anything else, as I was telling a few minutes earlier, worry wart and feeling guilty about it, and so much of time is spent, in fact, traditionally going to the temple, to doing puja, to 100 other such things, because she imagined something actually worse thing. And never forgets fight, romantic encounter, tender moments. We are all well aware that we all remember, in fact, there may be the first encounter and the first meeting and the first kiss and first holding the hand. Each of these type of things are actually, in fact, it is there in our mind. But women, it is registered so strongly that it is almost difficult to replace many of the times. And never forgets. There was a lady who had come sometime back. She was complaining that pain around the neck. She was telling, 20 years ago when she got married, a month later, there was some issue and he had hit at that particular point. Both of them are doing quite well at present, but all said and done, That small incident that happened, even today she carries it in such a big way. In the same fashion, I still remember one of my colleagues talking about, in fact, his wife supposed to have told that the Muhurtam saree which was purchased of not good quality. 3 months later, 6 months later, 1 year later, 10 months, in fact, 10 years later, 15 years later, she was again and again telling that the Muhurtam saree which was purchased, it was not of good quality. Sometime back, he says that she gave off all the sarees to some ashram and all of that. He felt that this old memory of something painful, this thing has actually gone off. Sometime later, when he opened the almirah, that saree is still there. In fact, he was telling, he asked her actually why this particular saree is still there. Her comment was to remind you. So what I'm trying to tell you is they won't forget. They won't let you forget. So this is one of the very important aspect, and which actually can lead to quite a bit of difficulty. And there are few specific male issues which interfere with the female sexual right. Coming to the male issues which concern the female, we have spoken in great detail in our communication. One important thing, what was actually that many women come and complain us, and when we are talking about the couple therapy, that he doesn't share anything with. He is almost always silent. He doesn't talk about money. He doesn't talk about what actually happened. And many of the women, I might be having the experience. You just ask a woman, how was the day? She may give a whole essay type of answer. You ask your husband whether how the day was. Most probably the response is it was good or bad, or maybe 1 or 2 words, and that is the end of the story. That is one aspect of it. The second one, what actually has been found is that see, hardly any man would be capable of doing or expressing emotion in this particular fashion. And this is what actually leads to quite a bit of difficulty. This video I had focused in our communication, this thing, but to emphasize the point. Men are like statues. He doesn't express anything. This is one of the most frequent complaints from many ladies. In fact, PC, in fact, documents about 10 seconds interview, a man, almost everything looks same only. But a woman can actually present so many emotions in any given 10 seconds time. If you are talking about 10 minutes, you even imagine maybe 10 minutes or 1 hour, hardly, in fact, in case of men, they are able to express. The explanations are many, and this is what I was trying to talk about during the communication class, that from the beginning, the girls are actually allowed to express emotions, but man is almost always not allowed to actually express what actually precisely happening. And this particular whole difficulty carried forward and leads to quite a bit of what we call the couple-related problems. Inhibited female drive. This I have already spoken a few minutes back. In fact, the whole brain, if you try to look at men and women, the sex dominates the whole picture as far as the man is concerned, whereas women, there are a lot many other related aspects. So you look at actually estrogen. In fact, people have documented this as Marilyn Monroe. And pheromones, the sexual signals. Oxytocin, dominant picture actually in case of a female, and this is one of the reasons is bonding, trust, and lot many things what we talk about. The molecule of love, PEA, in fact, this is one of the reasons why maybe the special ice cream, what you eat there too, the chocolates, what you love so much, in fact, it can make the flow of this PEA to a great extent. Natural sex offender drug, the progesterone, present in such great detail, and prolactin, hormone of nursing. In case of man, just rise in prolactin can be one of the major problematic this thing. And sexual response cycle, when we are trying to talk about, once orgasm he reaches or ejaculation happens, there is actually flooding of the brain with prolactin. And this is one of the reasons why man is not possible to get aroused immediately. And this is what we call it as a refractive period. These are a few of the things which actually have been documented very clearly. The other two important things. See, for example, testosterone. This is present in plenty as far as the men are concerned. It's a war hormone. He has to go and fight, win that particular lady, and a whole lot of issues are involved there. Once married, that whole that enthusiasm or what you call that extra that adrenaline release for winning, that is actually knocked off. And vasopressin, that monogamy molecule, present plenty in case of women. And this is one of the reasons why men almost always seek variety, almost always seek different partners. The girl or the woman, the next door appears much more interesting. Many of these type of things are related to this particular fact, which is actually exactly opposite to what we are trying to talk about in case of females. And the dopamine, desire personified. And this is one of the extremely important common problem for sexual addiction too. In fact, whole lot of addictions also in general. And this is one of the reasons why alcohol, opium, other drugs, all of these things are major problems with actually the males. And unless we correct this particular aspect, when we are trying to talk about sensate focus, we don't succeed, because if somebody is alcoholic, somebody is dependent on something, and so many other such facts, our treatment won't proceed actually the way we are trying to talk about. Serotonin, in fact, up and down can make a whole lot of difference. And when we are trying to talk about women in general, the depression is reported 2 to 3 times, 4 times more than actually in case of man. How man actually manages is by taking alcohol to some other aspects. But serotonin decrease leading to significant depression, and that may be one of the major common problems. So when we are trying to talk about pleasure and happiness, many of the times men actually seek pleasure, and this is why going after women, taking alcohol, various drugs are extremely common. Happiness is not sexual. It is actually an internal experience, and it doesn't come by either money or this or that, and so many hundred other things what we may be talking about pleasure related. So this particular differentiation we have to understand. And when we are trying to talk about men and women, see, almost there is an interplay of so many things. One is dopamine, oxytocin, serotonin, endorphin. I have seen, we are married now you resign from the job and stay back at home. The man is actually at most carrying forward in harakiri as far as relationship issues are concerned. Many of the times, not actually allowing the person to actually deal with, enjoy, meet people, and be active, and missing actually that particular area means can lead to quite a bit of difficulties. And this is very well documented, this thing. And when we are trying to talk about female responsiveness, this oxytocin as one of the important key component. Many of the times in the initial romantic situations, we feel little hot, that flushing, they're all attributed to this particular fact. We feel like seeing that other person, whether he makes a good husband or wife and various things like that, it is actually testosterone dependent. And this oxytocin, it has a multifaceted role in attraction, touch, mating, sex, orgasm, bonding, labor, parenting, nursing. And when you are trying to talk about orgasm, particularly in case of female, it is actually primarily oxytocin dependent. And that initial hot sensation is attributed to this particular fact. A nice, beautiful lady came and sat next to you, in fact, attributed to this particular fact. But look at the marriage. Holding the hand for the 7 Pharaohs, at the end of it, this touch sensation goes off. And that's where he was after me, and so much of loveful actually towards me. Immediately after marriage, what has happened? Suddenly he has become a different man. One may be actually worrying about or getting concerned, but this is attributed to this particular aspect in our body. If a man is able to treat his wife as girlfriend, can bring about little variety, little bit of pleasure, fun, frolic. In fact, these are the couple who are actually likely to be, will be happy all through. There are a few more other important actual developmental issues also important for understanding sensate focus related issues that we all started actually the females, and why, in fact, there is actually deficient, and this particular problem continues forward. Oedipal and Electra and such other complex psychologists talk about, and what actually has been found, as far as the boys are concerned, though they reach puberty maybe 2 or 3 years later than girls, the sexual interest and activity is reported high. Somewhere it matches somewhere around 35 years. And as I was trying to tell a few minutes back, that if a woman is actually older than man about 2 to 4 years, that may be the best actually the combination. One more other thing, the menstrual cycles, which are extremely important for understanding, because premenstrually, the least sexual responsiveness. Maybe the God intended that reproduction and other related aspects, the mid-cycle too, with onset of menses, maybe the fun and frolic. In fact, this is for the pleasure. So these are the 2 peaks which have been reported. And as they enter somewhere around, why sensate focus becomes extremely important is actually somewhere around 40, 50s, all these female inhibitory hormones have become less. The woman suddenly becomes active. The relative increase in testosterone adds to this. But look at the man, it is actually downhill course. One is the age factor and a lot many metabolic and such other syndromes, leading to quite a bit of difficulty between them. And they were actually married for so many years, and now talking about divorce and all attributed to this particular fact. The 5th show, or maybe the 6th, the way the numbers have been given here, she can multitask. And multitasking, she has been put on so many things that the whole issue becomes so complicated. At the end of the day, because she is able to do so many things, you are giving her so many responsibilities, she's exhausted and out. I was telling in the last class, there was 2 people, the couple, both are working in IT and each one earning 100, that means 100,000, 1 lakh plus per month salary. And she has to get up in the morning, cook the food, and then go to Bangalore and come back in the evening and again prepare the food. Mother-in-law says that she has come as a daughter-in-law and she should cook, and she doesn't want anybody else to do. See, the whole issue, she's so much exhausted. Ultimately, she is left out with hardly anything worthwhile energy. Correct it. This is one of the other important points. For sensate focus, we admit the patients not because of anything, but just like going to honeymoon, totally get free of all the day-to-day drudgeries and concentrate on that. This is extremely important. And men can multitask, hardly possible. In fact, he can write multiple memos in different fashion. This is what actually he can do. So taking the woman out of the day-to-day drudgery is extremely important for when you are trying to talk about the female sexual responsiveness. This is the diagram repeatedly we have spoken, that man is faster on the gun. He is like a incandescent bulb when it comes to sex. The woman is like an iron box, heating. Slowly she heats up. And to reach that particular peak, she takes a lot of time. Given situations, particularly in the laboratory settings, people have documented, Marston Johnson's in particular, that she could be multi-orgasmic. But fortunately, without reaching orgasm also, in fact, passively also she can participate. So there is a long process involved in case of the woman. This is what a man understands. He works out to be what we call as a good husband. Absence of it actually leads to quite a bit of difficulty. So there is a long process for reaching the peak. But once he reaches the peak, she can take multiple peaks without much difficulty. The whole issue here involved is actually the relationship. And this is one of the reasons what David talks about, that seduction, sensation, surrender, reflection, quite romantic terminologies, but extremely important from a sexual point of view. You arouse, but you don't know how to take me to the peak. This is one of the very frequent complaint, and the reasons are many. For a man, anything female moving is more than sufficient. But for a woman, as you were trying to talk earlier, there are plenty of aspects which are necessary to keep her actually going. Fantasy alone, very small number. With intercourse situations, only about 1/3. With touch, in fact, many of the women can be taken to the orgasm. And with vibrator stimulation, almost 100% of the women can be taken for orgasm. This is what actually it talks about. Why sensate focus exercises are extremely important is actually for this particular aspect, that, in fact, she needs actually a little arousal, and the whole process is actually, in fact, all inhibitory female sexual dysfunctions. The treatment is actually what we basically call training the woman in masturbation. And we should try to look at the Basson's model. Multiple aspects, multiple areas, a woman can get stuck. And this is what actually why this sensate focus becomes one of the important issues. So coming to what we call sex, There are, one is penetrative, which actually the PDE5 inhibitors and lot many other things, what we are talking about men. That participative and recreational, these are the two things which actually call for different approach altogether. Here, actually, the relationship and all the related things actually matter. And when we are trying to talk about relationship, let me just hurry up a little bit of this thing. There are three words extremely important. It's actually intimacy and sensuality, and sex. I'll come 1 minute later. Intimacy is actually one of the
तू ही तो जन्नत मेरी, तू ही मेरा जुनून, तू ही तो मन्नत मेरी, तू ही रूह का सुकून, तू ही अखियों की ठंड.
Who doesn't like this intimacy? Everybody. In fact, love matters. That's what actually we say. Woody Allen, one of the statement, love is important, but while you are waiting for the love, the sex raises some pretty good questions. When you are trying to talk about intimacy, quality of interpersonal relationship among two people in a romantic relationship matters significant way. Lot of aspects are there. I'm not going to elaborate here at this juncture. How one attaches, the family dynamics involved, identity issues, the confidence with which one can proceed. Majority of these aspects are extremely important. What actually has been found, if a man is happy with the partner or woman is happy with the partner, there is not much problem at all. In fact, it's very easy to handle. In fact, sensate focus, here we actually succeed. When two people are fighting, still it is possible. When two people have stopped talking to each other, it becomes more problematic. So intimacy is one of the extremely important component in actually in understanding and managing. Everyone aspires. Unrealistic emphasis on sexual. Far too little intimacy in many of the families. So these are a few of the things actually which has been, and many of the times, many people get carried away by what is actually documented, demonstrated in case of movies and such other things, which are actually not much of use at all. The Sternberg's theory related to the romantic love, companionate love, fatuous love, that means intimacy, passion, intimacy, commitment, and passion and commitment. So different couples, different stories. Each one of these type of things actually may be extremely important. In the early age, passion actually dominates the picture. But as the later part, the passion becomes less and the intimacy aspects become actually dominant. So this is one of the extremely important component one should remember. You remember at this particular juncture that intimacy issues are first to be handled in management of sensate focus exercises. The second area is actually sensuality. It is experience of pleasure from one's sense. I still remember I was doing post-graduation and one of the senior fellow coming and telling this, the lady PG, that your husband was looking at a lot of girls on the way. Her comment was, more hungry, that much better. See, just making a little attitude change, so much of difference it can come. Many women controlling, actually insisting on husbands not looking at others is one of the major common problems. Taking baths, noticing breeze, listening to music, lighting candles, getting one's hair done. See, many of the women are actually very much interested in many of these type of things. I still remember one couple in the therapy, what we were trying to talk about, husband was telling, sir, she doesn't take bath every day. She's almost always in the nightie, which I feel very uncomfortable. It doesn't arouse me. When we brought this particular issue in the later session, her comment was very simple. Sir, please tell him that I am not his girlfriend, I am his wife. Because we are married, we don't have to bother about our body shape or the way we dress or keep oneself. In fact, this is one of the major common problems that can happen in many couples and which leads to. I was so much getting interested in her before marriage. Now, after one child, she has changed so much. This is what actually which creates quite a bit of difficulty. This is one of the extremely important components. So let us come to the sensate focus exercises. See, before we proceed into sensate focus exercises, how actually the therapy ends. There are a few classic examples. He made fortune before he was 30 by hard work, but he still can't make with his wife. It is all over for him in 2 shakes and she comes more or less on her own. Anyone wants to suggest what can be done in a couple like this?
Communication.
Maybe communication, and here actually the role of sensate focus comes into the picture. It is not just giving 1 or 2 tablets, but there may be a lot more things that need to be done. Beautiful. There is something awfully anonymous about their love making. 1, 2, 3, and it is all over. They don't know if they are coming or going. What do you suggest?
Lack of time for play.
So the sensate focus exercise means actually these are all important. Foreplay to lot many other things, maybe even including the sex, a lot of variety that need to be actually added. He can last forever, but nobody ever seems to care. Maybe you should, what he should try? Of course, the same story. For years and years, they have been making love in the same old way. 20 minutes of foreplay, 20 minutes of union culminating in mutual orgasm, and 20 minutes of catnapping afterward. No quick tricks on the kitchen floor, no mistake, and no variety. How could one can spice up their life?
So many
Experimentation, sir.
Beautiful. Okay, experimentation to variety to a lot many things. He's been trying to keep up with her for years. She usually comes just as he's really getting excited. He can't come for another 5 or 6 minutes. Many of the times it may not be the story, but exactly opposite, that he comes, but she doesn't come. What do you suggest?
after play.
No matter with whom she has been with and she has been around, it takes her a long time to have an orgasm. Some men wait for her and some don't. See, I was traveling from Kolkata to Bangalore, one of the late night flights. These Bengali fellows are little talkative fellows, and 3 fellows who were sitting in that one front row to my seat, they were talking, and this fellow was pressing that button again and again to attract attention of the air hostess. A little while later, she came, and his English was not good. He was telling, I am fingering and fingering, but you are not coming. Let me tell you what she could have told. I need little more than what you call fingering. So the sex therapy, when we are trying to use the word, refers to the behavior modification process for sexual dysfunctions pioneered by Masters and Johnson. Whole range of modifications one can actually introduce depending upon social, cultural, and such thing. It doesn't mean that the nude marathons, men in white coat watching you make love, or touchy-feely sessions. Sex therapists have training, facts, and techniques, have no secret formula for potency and happiness. Many people do not realize they can help themselves immensely, and what actually the therapist does is actually just the facilitation. Knowledge, common sense, and intelligence, these are extremely important. And from therapist's point of view, this makes a whole lot of difference whether you are a very successful therapist or not. If we ask any one of the, say for example, CBT in sex therapy, this is one of the sessions what people have asked me in Foxy. The process involved, whether we are talking about behavior therapy, the principle involved may be systematic desensitization, and many of these type of things actually run in some particular fashion. So initiating session as a couple, conducting individual sexual histories, couple feedback session, weekly or twice weekly couple sessions. That means there is a whole process involved. A typical course to involve about 10 to 25 sessions and follow up to prevent relapse. What I try to do in my clinic is those people who are willing to undergo change, that we actually suggest them 15 days to about a month's admission, because we want to get them out of their whole regular, actually the drudgery of their life. He has to get prepared for the presentation in the morning, and so much of work is there, and he is actually not ready for getting any free time, and asking him to do sensate focus, not going to work there. She is busy handling the whole of the family and so many people and so many guests and all of that. She is exhausted. It is not going to work in that particular fashion. So,
One question. You told that you advise 15 days to 1 month stay, indoor stay. But
yes.
Socially, how, because they have family, and to how you convince them? Because it's very difficult to ask someone to admit for 15 days or 1 month from their.
That's it.
Yeah.
But this is the whole issue.
Yeah.
To want success in the therapy means one should be able to invest the time and energy for this process.
Okay.
We do get, in fact, the whole issue is those people who want some injection or some tablet or something like that, they are not the cases for sensate focus exercise at all. For sensate focus exercise, say for example, immediately after marriage, how it is that they go for about 15 days, 20 days for a honeymoon. Here, something has not worked, and for all practical purpose, you take it. For sensate focus exercise is nothing but an honeymoon trip.
Yeah.
Understand this particular concept, then we know what we are doing is the right thing to do, and what actually the investment of energy and time, but from the couple and from the doctor, is a worthwhile expense. In fact, we are so happy to see people getting well and going back. And by outpatient and all of that, some people, say for example, only husband and wife are staying, and it is possible. Where privacy is there, it is possible. Where privacy is not there, joint families, both are busy and very much concerned about his work, profession, her day-to-day drudgery. They are not the people for couple sex therapy in particular, or in fact, what you're talking about, sensate focus exercise.
And sir, sorry to interrupt you,
Please,
because
please.
sexual problem
I'm
are
happy to answer all these things.
sexual problem are not that much. They are open to talk with everyone. So, how you convince them to admit? Because it's for some medical problem, it's easy to convince them that you get admitted. But for sexual problem, it's not easy to convince them to get admission. So
it is not easy. Okay. That it is not easy. One point of this thing.
Yeah.
The second point, when you take it, for example, there are some cases which are referred to you specially. That means already many people have handled this and they have not succeeded. Many of them might have come to you actually with an idea that actually you are going to do a good job, and ultimately they may be actually getting the benefit out of it. So in the beginning, some people may feel that somehow we will try to manage and all that, but it is not going to work that particular way. See, getting erection in the man is not difficult at all. Very easy. But if you are trying to talk about sensate focus, investment of time and energy in this particular process by both the couple is extremely important. Without it, doesn't work. In fact, we are doing it. In fact, the people agree, and in fact, they cooperate. One has to believe in this process that actually I'm trying to benefit them, and actually you are benefiting them.
So all the sensate focus therapy, it's indoor therapy for you?
Not necessary. That's what
Okay.
I told you. If they have privacy, they are educated, they understand the psychological issues involved, outpatient is absolutely fine.
Okay.
But many of the families where, in fact, to both of them to come for therapy itself is very difficult in many of the families, because
Yes.
why both of you are going out, why so many frequently you are going out, and what is actually happening between you two. And this type of critical and such other environment, it is almost impossible for anybody to invest energy on this particular process. Online, some people are trying some of these things, but important point is actually couple having sufficient time for this particular process. And when we are trying to talk about common sense changes bringing about in case of men, women, to make them comfortable. Say, I still remember one of the couple, we talked to them to go eat something and come back. That way they develop little bonding and all of that. One couple went outside. She wanted to eat bonda and he wanted to eat dosa, and they quarreled for 1 hour, came back without eating. You got the point? Sometimes it looks so simple, but all said and done, these are all very simple looking common sense related steps. They are all extremely important. See, for example, she's working so much in the kitchen, but this fellow just sitting and watching the TV or reading the newspaper, not going to work. See, they had some small quarrel in the morning, and 5 o'clock now they have come back. Who should talk to each other? Anybody? Neeraj Saab.
Yeah, anyone can try, no? Because it's not.
So don't wait for her to talk or he to talk. In fact, she believes that he has done the mistake, and he believes that she has done the mistake. So not going to work that particular way. Breaking the silence is one of the extremely important. When man comes, in fact, this is one of the very common problems. In fact, she's not working from the morning till evening. She's waiting for him to come. Once he comes home, a whole lot of things are actually, in case of men, testosterone is released in the form of pulses every 20 minutes to 30 minutes. Many of the times you start talking about too much and put him under pressure, he may flare up, volcano buzz, and in fact goes off somewhere and meets some of his friends and comes back. Once this particular testosterone release actually over, and that particular time, whole lot of things you can do. He may be like a lamb following all your instructions. So making him comfortable and then actually taking the class is much more easier and better than actually starting. I still remember the couple, in fact, she doesn't want fan and he wants fan. What to do? It looks very simple. You please suggest what one should do.
They try to in between whatever is mutual to them.
This is easy. See, but unfortunately, what happens between couple, this itself is one of the whole major big issue, because she may go to the another room and sleep, and that's what actually it leads to a whole lot of difficulty. I still remember somebody telling that she should cover herself fully with a blanket and then expect sex to happen. Not possible, is that? So some of the answers may be very simple, but one has to make some via media is actually one very easy, understandable situation. But many couple, there is actually difficulty in making that particular thing, make them understand. Sex as something actually bad. This is actually ingrained. Acrobatics. In fact, am I a prostitute? Am I this thing? Am I that one actually? In fact, I still remember one of the very recent case. He told her that, in fact, when having sex, he imagines one of the nice, beautiful film actor. Following that, about 1 year ago, what he mentioned, she has not allowed him to come and touch her, mainly because you are imagining something else and you have used me as a prostitute. No, women can actually sometimes, the baby. Very recently, one more couple. In fact, now the daughter is 15 years old and she always sleeps with the mother. In fact, that is not the very ideal this thing at all. That. In fact, the individuation separation, what we talk about in psychological terms, they are extremely important. And what actually women expects, what actually happening between two, we have to bridge somehow some important ways. And what can be done in that particular area is one of the things, small.
You know what? Let's just not talk. Bye. ये तू और सिर्फ हमेशा लड़ते ही रहते हो. प्रॉब्लम क्या है? प्रॉब्लम ये नहीं है कि मैं लड़की हूँ. प्रॉब्लम ये है कि लड़कों की लाइफ में जितनी भी प्रॉब्लम्स होती है ना, उन सारी प्रॉब्लम्स के लिए हम लड़कियों को ब्लेम करते हैं. और वैसे भी अगर मेरे लड़कियों ने से इतनी ही प्रॉब्लम थी तो भाई गर्लफ्रेंड बनाया क्यों? कोई बॉयफ्रेंड ही ढूंढ लेता. वैसे भी ऑल यू गाइस नीड इज योर फकिंग गाय टाइम. तो ठीक है ना, बंदे पटाओ. साला जब तक इन्हें हाँ ना बोलो तब तक तो कुत्तों की तरह पीछे पड़े रहेंगे, और जब हाँ बोल दो तो ओए होए 2-4 दिन बड़े प्यार से बात करेंगे. मेरे शोना बेबी ने खाना खाया और मेरा बेबी अपसेट है, मेरे बेबी को क्या हो गया, और 2-3 दिन बाद ऐसे रिएक्ट करेंगे जैसे हम इनकी गर्लफ्रेंड नहीं इनके लैंडलॉर्ड हो. इनसे जरा बात करने को बोल दो, रिएक्ट ऐसे करेंगे जैसे इनके महीने भर की सैलरी मांग ली. अरे भाई इतना भी क्या बिजी हो कि 2 मिनट बात नहीं कर सकते? बनेंगे ऐसे जैसे दुनिया का सारा काम यही कर रहे हैं. एक टेक्स्ट कर दो, 10 घंटे बाद रिप्लाई आएगा. चलो कोई नहीं, फिर भी हम सोचेंगे अब तो कुछ ढंग का लिखा होगा, कुछ रोमांटिक लिखा होगा. और लिखा क्या होता है? ओके व्हाट द फक. ऐसे रिएक्ट करेंगे जैसे मोदी के बदले कोई काम यही कर रहे हैं. उसके बाद अगर इनसे कंप्लेन करो तो बोलेंगे बेबी आई वाज बिजी, प्लीज ट्राई एंड अंडरस्टैंड. और अगर कंप्लेन ना करो तो बोलेंगे बेबी आई थिंक यू लॉस्ट इंटरेस्ट इन मी. तो भाई तुम्हें बता दो, करे तो करे क्या? खुद चाहे 10 लड़कियों के साथ घूमने जाओ, कोई प्रॉब्लम नहीं. हम एक दिन अपने बेस्ट फ्रेंड के साथ घूमने चले गए तो सारा खोया हुआ प्याज आ जाता है. अचानक से हमसे मिलने का मन करता है, और जहां किसी बात पे आर्ग्यूमेंट हो जाए और इन्हें पता चल जाए कि गलती इनकी है, जो कि 90% ऑफ द टाइम होती है, वहां इनका रोमांटिक मोड ऑन हो जाता है. अगर प्रॉब्लम शेयर करो तो बोलेंगे तुम तो हर छोटी छोटी चीज पे टेंशन लेती हो, एक्ट लाइक अ मैच्योर्ड गर्ल. और अगर प्रॉब्लम शेयर ना करो तो बोलेंगे तुम तो कुछ शेयर ही नहीं करती, हमें कैसे पता चलेगा दैट योर मूड इज ऑफ. तो जो गेस करने के लिए बोला किसने? व्हाई कांट यू जस्ट माइंड योर ओन फकिंग बिजनेस. कुछ चूतिए तो ऐसे भी होते हैं जो अपनी गर्लफ्रेंड्स को बोलते हैं मेकअप मत लगाओ, तुम्हारी ब्यूटी सिर्फ मेरे लिए है. हाँ ये क्या पहना हुआ है? द नेक इज सो डीप, आई डोंट वांट एनीबॉडी एल्स टू सी एनी ऑफ योर पार्ट्स. ओ हेलो, तुम लोग क्लीवेज के ऊपर कब बढ़ोगे? हाँ, और भैंचो नंगी थोड़ी ना जा रही हो बाहर. और सबसे फनी बात, कभी इनके साथ घूमने निकल जाओ, उल्लू की तरह इधर उधर देखेंगे. क्यों? क्योंकि इनके पास बोलने के लिए तो कुछ होता ही नहीं है. और हम बोले तो बोलेंगे बकर 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 करती हो. अरे मेरे बाप, जब कुछ बोलना नहीं है, कुछ सुनना नहीं है, कुछ समझना नहीं है, तो डेट पे आया क्यों? गोलगप्पे खाने.
मुझे तो ये समझ नहीं आता कि हमारी शॉपिंग से क्या प्रॉब्लम है। वैसे तो दिन भर दूसरी लड़कियों को घूर घूर के बोलेंगे, बेबी ऐसे ड्रेसअप हुआ करो, बेबी वैसे ड्रेसअप हुआ करो, मेरी चॉइस के कपड़े पहना करो। और जब इन्हें अपने साथ शॉपिंग पे ले जाओ तो बंदर जैसी शक्ल बना के उल्लू की तरह किसी कोने में खड़े रहेंगे। चलो माना कि कभी कभी मैं पूछ लेती हूँ कि मोटी लग रही हो नहीं, बट वो सिर्फ इसलिए बिकॉज आई डोंट वांट टू इन्वेस्ट इन समथिंग व्हिच इज नॉट लुकिंग गुड ऑन मी। इसके पीछे कोई और रीजन नहीं है। अब भाई तुम्हारे साथ आए हैं तो तुमसे ही पूछेंगे ना, बाहर खड़े चौकीदार से तो पूछेंगे नहीं। और वैसे भी दीज गाइस शुड थैंक अस, क्योंकि इनके घर में जितना भी थोड़ा बहुत सामान है ना वो हमारी वजह से, वरना किसी सिंगल लड़के के घर चले जाओ, एक लैपटॉप और एक लोशन के सिवा कुछ नहीं मिलने वाला है। इन्हें फोन कर लो जरा, या तो कहीं और ध्यान होगा या कर रहे होंगे। ऐसा लगता है एक टाइम की बात तो किसी इंसान से नहीं, किसी पिल्ले से बात कर रही हूँ। इन्हें भाप दो तो चेप हो रहे हैं, भाप देना बंद करो तो रोना चालू। तुम्हें पता है पहले ना राजाओं की 3-4 बीवियां हुआ करती थी और बंदे सबको बैलेंस करके रखते थे। यहाँ आजकल के लड़कों से एक नहीं संभलती। और वैसे भी ये तो पुराने टाइम से है ना कि लड़के एक साथ 3-4-5 हजार लड़कियों को पटा सकते हैं, लेकिन लड़कियां ना 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 ना, लड़कियों का एक फ्रेंड भी इनसे देखा नहीं जाता। लड़के का अगर एक से ज्यादा रिलेशनशिप हो तो वाओ ही इज अ डूड, ही इज अ प्ले बॉय। और अगर यही सेम चीज लड़की करे तो दे स्टार्ट कंपेयरिंग हर टू अ स्लट। खुद चाहे हमारे ऊपर कितना भी चिल्लाओ, हमने अगर गलती से ऊंची आवाज में बात कर ली तो हम चुड़ैल लगने लगती हैं। वैसे भी ऑल यू गाइस कैन डू टू विन एन आर्गुमेंट इज शाउट, बिकॉज उसके अलावा तो कोई और तरीका होता ही नहीं ना आर्गुमेंट जीतने का। और कमांड करने का तो जैसे इनके पास बर्थ राइट है। खुद चाहे जितने मर्जी कमांड करो, उसे ऐसे दिखाएंगे कि बेबी वी केयर फॉर यू, दैट्स व्हाई वी डू ऑल दिस। और अगर यही सेम चीज हमने कर दी तो हम पॉसेसिव गर्लफ्रेंड बन जाते हैं और दुनिया भर का सारा प्यार तब जागेगा जब इन्हें सेक्स करना हो। हम तो इसी चीज के लिए बने हैं ना। और इनकी फरमाइशें, बेबी लेट्स टॉक डर्टी, बेबी वीडियो चैट, हैंड जॉब, बेबी ब्लो जॉब, भैंचोद ऑर्गेज़म फेक करते करते मैं खुद ही फेक हो गई हूँ। अच्छा, सेक्स करने से पहले 1000 प्यार की बातें, बेबी आई लव यू, बेबी कपड़े धीरे धीरे उतारो ना। और अगर वही कपड़े सेक्स की बात पहनने में थोड़ी सी देर हो जाए।
So what actually a woman expects and what actually man does, there's a whole lot of difference. And this way, when Master Johnson also believed that relationship actually matters significantly. And with this particular process, a lot number of people actually can be successfully treated. Designed for couples suited for vague and non-specific problems. For couples who have forgotten or never learned arousal sensation. Pleasure to both the partners is actually the aim. What is arousing for him or for her? In fact, there may be wide actually differences possible. So when you are trying to talk about sensate focus exercises, everyone would have trouble with sex sometime. This is one of the important points we should remember. Often problem with a matter called control. A perfectly orgasmic woman, but all unfortunately happening is she is not able to reach there because her needs are different and his needs are different. So orgasm, put it in the proper perspective, more to sex than just orchestrating orgasm. This is another important point. It's almost like people, what they say, you are climbing the temple, not just closing the eyes and reaching the top is not the point. A helicopter can take you and drop you there. But enjoying the process of climbing that mountain, that's what actually the whole sensate focus exercise is about. So these are all specific activities developed by Marston and Johnson's, and we'll try to look into some of these aspects which are actually necessary for understanding. So communication relationship forms the deep, main important first step in the whole understanding. Without communication, you are nothing. We are all well aware, verbal and non-verbal, both actually matter. And many of the times, relationships get into the big problems not because of anything, woman insisting on having a house, the car which actually has been brought by the neighbor, and other minor related these things actually creating quite a bit of difficulty. And many of the times, many women actually fight and create quite a bit of difficulty, which actually keeps the partner little more away than actually for which actually they were trying to fight.
Sadhguru, jealousy is always considered as a really cynical emotion. But to be honest, for me, it has worked so well.
What did you get to do?
It motivates me. So every time my friend learns something new, I just get this innate urge to perform better. And it's probably why I've landed up in my dream college. So, do you think that jealousy is actually a negative emotion, or does it motivate you to do better?
See, these days, fortunately, it's gone. When we were growing up, especially Diwali is coming. When Diwali comes, in small towns, one of the fun that people have is they will make a can full of, the firecrackers and tie it to a donkey's tail. When it goes dum dum dum, poor donkey runs all over the place faster than a horse. You think that's the way to motivate life? There are better and more intelligent ways of doing things. Well, when you feel like your tail is burning, you may run. People always use this thing, if a dog is chasing you, you will run really fastest. But Mr. Bolt, you know Mr. Bolt? He did not run because his tail is on fire. He runs because he prepared his legs and lungs in such a way, whichever way he runs, he is faster than everybody. Hello? Isn't that the way to run? You want to run because a dog is chasing you, you want to run because your tail is on fire, is it the way you want to run? No, that's not a pleasant way to run. See, one thing is important that you run fast. Another thing is that your experience of running is fantastic. Isn't that important? Hello? Well, you got into your dream college, but it could be hell, 3 years of hell, who knows? Is it not important that these 3 years are a fantastic experience for you? Huh? Not important? Running is not the only important thing. How you experience it? What comes out of it tomorrow? Suppose we ran because our tail is on fire. Now we understand the only way to make people run is to set their tails on fire. How much damage we will cause to everybody? And I've seen these donkeys running faster than a racehorse because they're terrified. That's not the way to run. Please don't do that to yourself, not anymore, okay?
So extremely important. We almost in the sensate focus exercises, we tell them, see, for example, you prepare the coffee and go and give it to him. In fact, it's a fun. Don't go with an idea that he should get up early and he should stand there and prepare the coffee. If he does it, it is well and good. I have seen a couple fighting because he went to the bathroom and he had not taken the towel inside. Go and give the towel. What is the problem in that? So what we are trying to emphasize point is actually a simple adjustment can make a lot of difference. When he has come to the home, sit with him and talk to him. In fact, this being friendly can create quite a bit of difference actually. I still remember, in fact, the bathroom, taking the towel inside. In fact, that itself can lead to one of the romantic situation actually. I still remember one of the family very recently, they had gone for a tour and they're reaching the place. We'll eat outside. Wife was telling, why you want to waste so much of money on the hotel? We'll go and I'll prepare the food. See, going home, getting tired and preparing rice and sambar, it is not easy job. Go and spend some time. In fact, we have to actually pick up situations and activities which actually easy. Don't confuse the man with a lot of things like, I want brinjal color saree. This fellow doesn't understand what color and all of that of things. Actually, brinjal means he went to the market and you could find that there are so many colors are there actually for the brinjal. Which color saree he will bring it? You tell him, I want green color saree or another one which actually of your choice. Much more easy. Expecting man to understand your points and then actually doing is actually something totally different. So in therapy, see, for example, here is one of the very intelligent lady. Man cannot understand a lot of things. I want tomatoes like this, onion like this, methi, how it should be, potato, bhendi, mirchi. See how beautifully she has handled. The point is not necessary all the people, all the time, all these things are necessary to be done. But all said and done, in a given situation, one should be able to work on the idea how to make things simple and actually pleasurable and enjoyable. scolding, getting him actually, in fact, active that particular way, it is not going to work. So in sensate focus, when you're trying to talk about counseling, men understand certain things in some particular way. Women understand things in a different way. And exactly between them, there may be a world of difference between actually the meaning which is actually there.
Hello, Madeline. Hi, Cliff. Guys, I'm here to help you today. Okay, so tell me what I can do for you.
Well, when I talk, I feel like Cliff hears me, but he doesn't listen.
How does that make you feel?
Frustrated.
Cliff, by not listening to Madeline, you're invalidating her feelings. Now, does that make sense to you?
Honestly, not really.
Okay, maybe this will help. Say you're playing a par 5 at Pebble Beach.
Yeah?
Okay, you crush your drive, the wind's behind your back. Your second shot finds its way to the green. You're on in 2. Then you 4-putt for a bogey. That's how Madeline feels when you don't listen to her.
No. No, that's how you feel? Oh, babe, I'm so sorry. I had no idea.
What else, Madeline?
Well, it'd be nice if you liked my Instagram posts once in a while.
Yeah, I'm not a big, Instagram guy, but, I mean, I think you're beautiful.
Well, sure, but it'd be nice to hear it once in a while.
Cliff, you know that feeling when you hit the ball out of a greenside bunker to within a few feet from the hole? Golfer from 1 tee box over yells out, "Nice shot!" That's how Madeline feels when you like her Instagram post. Feels good, doesn't it?
It's a good feeling.
Yeah, it is. Okay, Madeline, why don't you try now?
When it comes to intimacy, it's very important for me to feel emotionally connected to you.
That's great. Now try putting it into terms that Cliff will understand.
Okay. Here goes. You've got your golf club.
Okay, which club?
I don't know, one of the metal ones?
Maddie, an iron is what we're thinking here, I think, yeah?
An iron, yes, an iron.
Okay, which one?
The 5th one.
Okay, so the 5 iron is what you're saying? I love my 5. Okay, keep going.
Okay, it's 140 yards to the hole.
5 iron, 140 yards? Are you freaking high? That's an 8 max. You see how hard I'm hitting the ball since I changed my swing path?
I'm just making an analogy, okay? It doesn't matter.
It matters. It definitely matters. Which way is the wind blowing?
North?
Is it morning? Am I playing the blues? Am I playing a cut? Am I playing a fade? What about the slope? Do you even know what a slope means?
Are these real things?
Are these real things? It's like we're speaking different languages.
Well, hey, cool it off. I have never seen it this bad before. I don't know if we can even salvage anything.
So it is extremely important to make people understand. In fact, you may be thinking that it is easy to understand, but among the couples, it is actually very difficult. The second point, before you think of sensate focus exercises and all of that, any of these biological problems, if it is present, ruling it out and actually making corrections related to that. Somebody is alcoholic, the sensate focus exercise is not going to work. You have to treat his alcoholism first, and then actually the issue comes. I have seen women actually not liking the man smoking, and that smell actually puts her off. You have to treat this fellow's smoking habit and what best you can do for this thing. Eating, putting on weight, and many of these type of things, in fact, some of the areas. And when we are trying to talk about women, there are a few things where you have to rule it out. In fact, one of the important step in couple therapy is ruling out organic factors. And I still remember many of the women actually in Indian context, as gynecologists, you are all well aware.
सोना 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 जाने तेरा मुल्क तो में तेरी लोहा तू हो जाए अनमोल तेरी लोहा को ओ हीरो खले
iron, anemia, hypothyroidism, depression, if some aspects of these things are present, need to be treated first. If you are treating depression, try to choose a drug which actually, in fact, avoids problem. Privacy, this is actually missing. In fact, when you are trying to talk about elderly sexuality, this is very commonly we talk about. But absence of privacy at home, it's only to emphasize that point among the young couple. In the world, in fact, this particular story. So privacy is one of the extremely important thing, and I just cut that video a little earlier. So coming to the one is intimacy related aspects. The second one is actually the different senses, how actually it does. See, man's vision and the woman's vision are something totally different. And many women, in fact, one of the pickles jar which is there, you ask him to bring, he may not find where it is related to this particular fact. Men are extremely good in vision. This is there from the beginning. Men are very poor in actually hearing. They can't multitask. Whatever you want to tell, about 25 to 30% deficit in hearing capacity as far as acuities of hearing is concerned. So whatever you want to tell, go near, tell in simple terms, tell one or two items only. That will be a much better actually than, that means men and women, there is a wide difference. The women and men actually they have to make a little bit of a modification in how actually they go about. So these are all actually part and parcel of what we call counseling processes involved. Women always worry about the things that men forget. Men always worry about the things women remember. In fact, this is one of the story which is there much of the time. And many men actually feeling.
Hi, baby. Alex and Jimmy are asleep. How's work?
I'll forget about work. Sit down. Here we go. Happy anniversary.
Oh, Jerry. Oh, how did you afford this?
I saved my pennies. You like it?
Oh, Jerry, I love it. Now, I have something for you, too.
Okay.
Now, I know that since the kids were born, our sex life has cooled down. So tonight, on our anniversary, I'm going to give you something you've been wanting for a long time. And I know we can't afford it, but I've been saving up too, so don't ask any questions. Just enjoy it. Allison.
Happy anniversary, Jerry.
Pam?
Isn't she great? I want this night to be a night that you remember forever.
Oh, wow. Yeah. No, that's great. Wow, I'm gonna love this. Okay, come here. Oh my God. Wow, honey, I've been dreaming about this for so long. All right, well.
What are you doing? Jerry, this is the babysitter.
What? Babysitter?
Yeah, babysitter. I hired a sitter so you and I could go to a hotel tonight alone.
Oh, whoa.
What man thinks and what actually woman thinks, there is a wide difference. And for man, the physical sex dominates the picture, which actually many women find it very difficult. He doesn't listen. This is one of the extreme. In fact, hearing and listening, there is a big process difference involved. We have already spoken. When you are talking about sensate focus, the touch is one of the most important point. And let us understand what actually, in fact, why touch is important from the sex point of view. Just a minute.
अरे लेकिन मेरी बात तो सुनो।
मुझे कुछ नहीं सुनना, सब कुछ खत्म। वकील साहब मुझे तलाक चाहिए, इस आदमी के साथ नहीं रहना मुझे।
लेकिन क्यों? ये तो कबड्डी चैंपियन है।
यही तो प्रॉब्लम है, कुछ करता नहीं, आके छू के चला जाता है।
So skin is one of the biggest sensory organ in our body. And this is one of the extremely important component when we are trying to talk about sex therapy. And touch is one of the most enjoyable and interesting thing actually when we are trying to talk about sensate focuses. Loss can be terrifying. People have documented psychotic breakdown in absence of it. There is something called as touch hunger. Everybody needs this amount of touch every day like that. In fact, many of the times I am giving her a salary and we are taking care of her food and all the clothes we have provided. No woman is likely to be happy in a given situation that particular way. There is something called, which is missing, leads to quite a bit. In fact, you might have come across in your clinical practice, women presenting with multiple somatic complaints, aches and pains, burning sensation, and a range of somatic disorders. So this touch hunger is one of the very important aspects one should remember. The mobiles, the laptops, TVs have created quite a bit of havoc in many of the families. So let us look into what precisely, how actually one can go about. The important point in sensate focus is actually making the couple understand the self-awareness, physical. He who realizes the truth of the body can then come to know the truth of the universe. And there is but one temple in the universe, and that is the body of the man. Man and woman, of course, for both it applies. Nothing is holier than that I fall. By concentrating on the ecstatic forces within, wonderful visions dawn on the mind side. This is a special secret which shortens the journey to liberation. In fact, that's what actually the Tantra speaks about. So many people are not aware how actually this happens. To understand this, in fact, making them understand this, standing in front of the mirror, taking off clothes, understanding sensation in different parts of the body, and more particularly the sensitive and other related aspects, each of these things actually a process involved. In just simple terms, inhibited female sexuality, the management actually involves training the woman in masturbation. You take it for granted. And when we did one study on almost about 500 plus women who are married and staying with the husband and who are from the elite group, in the sense that they were part of the Rotary, Lions Club, and such other things. What we realized was only around 32% reported sometime, and only about 12% were reasonably comfortable. The reported figure in the Western countries is actually somewhere around 60, 70, 80%. So many women in our context won't even know what actually the pleasure is about, what actually orgasm is about. So making them understand this particular aspect is one of the very important steps. And this may involve 1 day, 2 days, 3 days, or 3 sessions, 4 sessions, and all of that. In fact, people, individual self-discovery and touch, how it can happen. I'll not elaborate into this, but there is a lot of what we basically call a little bit of creativity can be involved in the whole process in understanding. What touch, what different body sensations actually. So self-discovery is one of the very important steps in actually what we basically call sensate focus therapy. People have suggested how actually, in fact, a woman can be trained to understand different body parts, including the intimate parts, how actually it can be done. Taking bath and all, in fact, they can add to the whole these things individually. Anything? So there are so many touch techniques are available. In fact, one can almost, these are all different massage techniques and all people might be talking about. All of these type of things are actually involved in a very big way. So masturbation training is another important step. So when you are trying to talk about sensate focus, couple learns how to touch and be touched without worrying about performing or reaching a goal such as orgasm. So what we are trying to emphasize in the beginning itself is, it is a process to get in touch with senses, to reduce spectating, goal orientation, to get it to a neutrality. That means enjoying each step on its own right, to get at self-representation and responsibility, to get at the neutrality, staying here and now, rather than good and bad, put on weight, thin and various color, various other such things. So the three main purposes what sensate focus does is to provide a structured approach which allows the couple to build physical intimacy and gradually rebuild their sexual relationship, to identify the specific maintaining factors of the sexual dysfunction, to provide specific techniques to deal with the particular sexual problem. So general guidelines are: give clear instructions, ask about anticipated difficulties, obtain detailed feedback. In fact, these are all home exercises, what we'll be talking about, or a couple in their room. View failures or difficulties as offering a chance to increase understanding. Adjust the pace to progress. Avoid introducing uncertainty. That means you can do this, do that, and in fact, intercourse, we have to be very clear in giving this particular interest. Make predictions, what likely to go wrong in this particular couple when sessions are planned. Have regular review sessions. So these are a few of the important steps one should be well aware of before proceeding with the sensate focus. So principles of sensate focus, another little more elaboration I have made here. It is just as important as learning what your partner likes is learning what you like about your partner. Taking turn exploring and pleasing each other and yourself during these exercises. Find out where you want to touch your partner, what part of his or her body, particularly what fascinates and delights you. When you are being explored, don't try to influence your partner with directions and requests.
Yes,
wait until they know what they like and then tell or show what you like. No intercourse during these exercises. They do not lead to big orgasm. They are complete unto themselves. Not having intercourse for 2 weeks, whether too long and all of that, these are a few of the other extra additional points, but actually one can actually possibly look into. Program schedule, unless the other complicated issues are involved, approximately takes about 2 weeks. This is what actually.
Apurva, is there any question from you?
Oh, any questions are there?
Apurva? Apurva? Okay, no. Sir, go ahead.
No question, sir.
Okay, Apurva.
So this program was described as a progression. Any of the exercises can be complete in itself. There being no reason why sex can't just mean being together, doing something intimate for both to enjoy. If intercourse and orgasms are the only goals, one may be missing the other things it takes to build comfort, trust, and understanding between people. And those are things one really cannot do without. So these are a few important points what we try to convey to the couple in the therapy, and as an introduction, this matters. And just to make you understand what is actually involved, next few steps are very easy to make out.
I use sensate focus often to teach couples how to re-experience sex for the first time. So what's sensate focus? Basically, it's a massage exercise where two of you are in different positions. So one of you is the massager and one of you is the massagee, meaning you're being massaged. And what you do is you touch each other non-sexually. So no boobs, no butt, no breasts, no vaginas, no penises. You really focus on the non-sexual organs. And what you do when you're the toucher is you focus on temperature, texture, or pressure. How do you focus on temperature? Well, one thing you do is when you're touching your partner, you might notice parts of their body that are warmer or parts that are cooler. That's focusing on temperature. If you're focusing on texture, you notice the parts that are smoother versus the parts that are more rough. Elbow's kind of rough, see? And if you're focusing on pressure, you pay attention to how you can touch in different ways and feel pressure in unique new ways. Like, do you like to give a firm pressure? Or do you like a soft pressure? Do you like pressure more in different parts of your body? Here's the key. When you are in the toucher role, you are touching for your own pleasure to enjoy those aspects of your partner's body. You're not necessarily trying to touch your partner for their pleasure. Now, in the touchy role, though, we don't want you to get hurt or feel uncomfortable, right? So when you're being touched, you have a couple jobs. One is to communicate to your partner if they do anything that's like irritating or painful. Say, hey, can you move out of that general location for a bit? And using a good communication skill is helpful. So like guide your partner a little bit towards something rather than away So like say they've been rubbing one area for too long and it's just irritating a little bit. You can say, hey, why don't you move off that maybe to my stomach? Or why don't you use a firmer pressure there rather than a soft pressure? Either way, you're guiding them towards what might make it feel a little better for you. But then other than that, you really just enjoy being touched. And the way to do it is you take at least 10 minutes each to be in each role. So you get a chance to explore touch in different ways. And another thing that makes this kind of fun is you get to explore trying new styles of touch. So you can touch with your fingers, you can touch with your fingertips, you can touch with your fingernails, you can touch with the back of your hand, the front of your hand, you can touch with your elbow, your face, your nose, your hair. Part of this is really just a creative exploration. Like, how many different ways can I touch my partner and enjoy this? Some people suggest that sensate focus be done without sex at the end. There's different reasons for this, and you can do that if you like. I always let my couples decide what they want to do. If they really can't help it and they want to have sex at the end of it, that's fine for me. I do encourage them to sometimes try to do sensate focus without it, because part of the job of this homework assignment is to take pressure off sex. And I think sometimes people are so focused on that end result, like we got to get to sex, that they miss a lot of the stuff that really gets them in the mood for sex. So in many ways, sensate focus is teaching quite a few things. It's teaching you to value some of those precursor things. It also teaches you to be more mindful and present. Another piece that's getting in the way for people with their sex is they're so focused on got to get to the orgasm, got to get to sex, got to do this. And it has to be exactly this way, that you're putting pressure on sex and you're not even enjoying the wonderful steps along the way. And so couples who use sensate focus tend to do best if they do it regularly, and they use it in addition to some other pieces of their sex life. Like you can still have sex outside of sensate focus, or some couples will use sensate focus to just get comfortable touching and being vulnerable with each other again. And then that can start leading them back into sex. So if you've never tried it, I encourage you as a couple to maybe set a goal for yourself of trying sensate focus. I usually encourage my couples to try it daily if they can. If you can't, come up with a reasonable number, but aim high, because we almost never meet the goal. So if you aim low and you get lower than that, you're going to be really disappointed. Thank you.
Why I just focus this, and there are people actually who suggest sex can be permitted, but during the sensate focus exercise, we try to avoid. There are 3 stages: non-genital, genital, and vaginal containment. How actually the setting is made. In fact, one can very be creative in this whole aspect. Decorate the walls of the love chamber beautifully, and the romantic situations, how it can be created and all. I'll leave it to the people to imagine and actually get into that. So non-genital sensate focus rules are: agree not to have intercourse, nor touch breasts and genitals. Explain why. If positive or neutral, continue. If there is a problem, better avoid that. Masturbation allowed only in private, not in front of the partner. Start with no clothes. Taking off clothes itself can be a process in some individuals. Receive her on tummy, provide her what she likes, and just make sure what he or she likes. So first week, Monday, explore, start with something small like a hand. Is it soft, rough? What is the shape, color? Start with ear. It's preferable. Each and every organ, one can actually elaborate on that. Is it clean, pierced, hairy? See, one of the whole aspect involved is actually spending as much energy and time on this particular aspect. It is not watching. In fact, the sensations that actually each of these things generate is the focus. Now pay some attention to your partner's clothes, how they complement, how material is sensuous, how in fact the scent, if actually you are able to appreciate. All these type of things are extremely important in understanding. So there are multiple ways actually.
Sir, you said it's 1 day, or it can be 2 days, 3 days, like observation, and then.
It all depends. For example, there are people who can move from one step to the other step every day.
Okay.
There are some people who may take about 2 or 3, 4 days, 5 days actually for each step to move forward. This is one of the reasons why the 15 days is not actually sufficient in many of our couple who come actually under our care, what we have seen. They may need anything more than 15 days to 30 days. That is because till they master and feel comfortable about something, you don't proceed further beyond that. Marston Johnson suggests this is called as non-demand sexual position, wherein the partner can reach different parts of the body without much difficulty. One can be very comfortable in this particular situation. How to touch, in fact, genitals are off limit. In fact, these are all the things, in fact, we explore, and the questions we will try to answer, and actually from the front, from the back. In fact, the many such aspects are involved in training them. Hand-writing techniques, some of these type of things. Taking bath together. In fact, here the intercourse is not the issue, but appreciating each other. In fact, the water could be one of the interesting and important medium for the couple. The giver is to explore his or her own personal pleasure in doing the touching, to experience and appreciate the somewhat indescribable aura of physical receptivity expressed by the partner being pleasured. After a reasonable time, the partners have to exchange roles of pleasuring and being pleasured. In fact, as a second level, partner who is pleasuring is committed first to do just give pleasure. And then actually, in fact, giving pleasure, receiving pleasure, this particular way, actually the things move. And when you are trying to talk about genital, agree not to have intercourse, neutral aspects is necessary, masturbation is allowed only in private. As previously, bush and the genital touching is allowed, but not to concentrate on genitals. Example, touch lightly on clitoris, stroke around vagina, also thighs. Specific coming to the penis, scrotum, also other parts of the body and thighs. This is actually a process one has to learn, and something right, wrong, but trial and error may actually in the beginning may be actually necessary, and goes on in that particular fashion. Genital sensate focus. Agree not to have intercourse. Here, orgasm is allowed in the second phase. Genital sensate focus 3. Orgasm is allowed and masturbation as previously, in fact, mutually. In fact, all these things can be carried out. So the steps are actually, there are about 7 or 6 depending upon how you go about. Sensate focus without genital contact. Sensate focus with genital contact. Sensate focus with the genital contact, A caresses B and B caresses A. Sensate focus with the genital contact and simultaneous caresses. Vaginal containment with movement. So this is actually one of the whole process involved, and we have actually quite successfully one can manage. When someone is actually having ED or ejaculatory dysfunction, there are different ways actually. In fact, you might have heard of stop, start, squeeze, where actually to do that anterior-posteriorly. In fact, getting the erection, giving the pressure, taking it off. That means one can learn to control how long he wants it to be actually erect, how long actually he wants to wait for the ejaculation to happen, when to ejaculate. If something goes wrong, one need not have to worry. The coronal squeeze and basal squeeze, these are the 2 other different these things actually. In fact, one can elaborate on this if time permits a little later. Vaginal containment. See, important whole issue here is the vaginal penetration is the main source of anxiety in many people, and the different positions people have suggested. The female superior position is actually one of the things because she is under control. Man invariably runs faster, and he is likely to create difficulties actually. So how actually, in fact, without movement, just getting it inside, experiencing and the pleasure which is associated with that, and then introduce the movement and actually proceed in that particular fashion. So different positions and all, like subsequently what can we do? Many of the times what we have found, both are focusing on this particular, the pleasure aspect is extremely important, and getting distracted by anything, actually it spoils the whole process involved. Carry home message. I'll be available for questions if there are actually. Let me tell you, in fact,
आप सच में लड़की हो?
What? आप तो ऐसे पूछ रहे हो जैसे कि आपने कभी कोई लड़की नहीं देखी?
नहीं देखी।
क्या?
वो क्या है ना, जब छोटे से पापा ने बॉयज स्कूल में एडमिशन करवा दिया, उसके बाद हमने मैकेनिकल इंजीनियरिंग ले ली, पूरी किस्मत हमारी। और अब जहाँ नौकरी कर रहे हैं वहां पे बस मेल ही है। बचपन से हमारी राशि में कन्या रही है, जीवन में नहीं।
आप अब टेंशन मत लीजिए, अब आपकी राशि के साथ साथ आपकी लाइफ में भी करना।
Women and the whole process. In fact, one of the things is actually, in fact, jokingly I have put it, wife angry for a reason, wife angry without reason, and wife about to get angry and looking for a reason. In fact, many of the times the couple related issues are extremely important and one need to actually worry. I have seen people training their husbands to do household work, and in fact, men can never match you in that particular area. This is what actually we tell the women. You might have, so make use of the husbands or the partner for actually sex, not for others. In fact, this is one of the very important to the things. The partner is actually the battery charger. In fact, many of the times adultery to lot many other
टेंशन लेने वाली कोई भी बात नहीं है, बहुत अच्छा है बच्चा और मेजरमेंट्स भी बहुत अच्छे हैं। देखिए भाभी जी, मुझे एक बात बोलिए, डिलीवरी के वक्त आप सामने किसे पसंद करोगी? आपकी माँ को? हाँ। सास को? हाँ। बच्चे के पिता को? नहीं। लेकिन भाभी जी, हर औरत बोलती है कि बच्चे के पिता सामने रहने चाहिए। मुझे नहीं चाहिए। लेकिन अगर वो सामने रहेंगे तो उनको खुशी होगी। मुझे नहीं होगी ना। और वो सामने रहेंगे ना तो आपका भी हौसला बढ़ेगा। अरे नहीं बढ़ेगा। लेकिन भाभी जी, बच्चे के पिता क्यों नहीं सामने चाहिए? नहीं चाहिए। लेकिन क्यों? क्योंकि मेरे पति उन्हें पसंद नहीं करते हैं ना। अच्छा। हाँ?
So, lot many issues. We have to, in fact, the perfect wife, perfect husband not available. One has to adjust. And where the relatives' involvement is there, our chances of success actually becomes less. A girl doesn't look for six packs in men. In fact, this is one of the common story. And the touch is one of the most important. Cure is the cuddle. And romance, relationship, appreciation, capacity to give compliment, all of these things are part and parcel of what we basically call sensate focus. If you never try, you will never succeed.
It was designed by God to receive. And whatever she receives, she incubates, multiplies it, and gives it back to the male. She was built to do that. So whatever you give a woman, she'll receive it, multiply it, and give it back to you. Whatever you give a woman, are you listening, brothers? She'll never give you back what you gave her. She'll multiply it first. She's designed that way. If you give a woman a sperm, you'll never get a sperm back. She'll multiply it, give you a baby. If you give her a house, she'll multiply it, give you a home. If you give her groceries, she'll give you a meal. If you give her frustration, she'll multiply it.
So actually not to give trouble, enjoy the life. For that, in fact, both man and woman, the act actually basically call as unison. Sex is the ultimate expression of love. To be able to give pleasure to a beloved person, at the same time receive it, is a unique experience, and this can seem like a small miracle. And this is what whole purpose of sensate focus is about. Each individual couple is actually something totally different, and one has to improvise certain things to bring that man-woman magic into this process. Thank you very, very much. I have exceeded the time, but all said and done, I think
we can learn on and on until you talk. Not an issue. It's very interesting, and you make subject so interesting and simple that it's hard to get bored. Is there any question, Manish, Apurva, anyone?
Sir, there is some Dr. Ravi.
Yeah.
And he actually raised his hand. Should
Yes,
I
Dr.
allow
Ravi.
him?
Yes, sir. Sir, in sensate focus therapy, which therapist can deal the patient in the OPD? Is it possible, or need any special setup? And how do you choose the clients? Which patient is suitable for sensate focus? And what is the understanding level, and is it possible in Indian culture? And please tell me your experience, sir.
See, absolutely, in the sense that many of us doctors are very comfortable writing some prescriptions, and that is the end of the story. And it is not going to work with all. This is one important point. Second, making a wife pregnant, or she is pregnant and all the life issues, problems are solved, that because of which it doesn't work in that particular fashion. A little psychological sophistication, financial stability, peaceful relationship, these are the people ideally chosen for this intensive therapy. We used to believe earlier who can actually take part in this whole process, but we have found, and we are ourselves quite busy with people who are willing to sacrifice. In fact, we have treated doctors and a lot many other people. Let me tell you, in fact, one of the very recently treated doctor couple, one is a physician, the another one partner is a gynecologist, this thing, pathologist. There was an exercise called as what you appreciate in the partner. In fact, he took 3 days to write one good thing about wife. No, can you imagine? So it takes, it puts up a little bit of effort on your part, but all said and done, these are not the regular day-to-day, in few minutes, anything can be completed. It is a process. And for that, you have to be having a basic knowledge about psychology, behavioral sciences in general, and your time and effort necessary for that. Your hospital, your consultation room, anything can be good enough. But where the privacy is there. What it means is, when there are about 4 or 5 clients in the room and you can't talk about these things. Sexual medicine practice in general calls for privacy, talking to each person separately, talking to them together, working out each of the steps. This is the process, and nothing extraordinary needed. See, for example, gynecologists and other specialists, they want big instruments and all of that. Absolutely, one table, 3 chairs, one for the therapist and 2 for the clients, more than sufficient.
Okay. Absolutely, sir. Sir, Dr. Ravi, I just wanted to say one thing. What we are doing, because we are a gynecologist, so we don't have much time with us. So we actually shows the picture. And I think Rao sir is definitely will agree with me. And in a short, with all those pictures which sir have shown, we can ask and counsel the patient about all those things. So this is, I think, one of the technique which I am using in my practice.
Many people don't need this intensive therapy by an expert. Very simple, common sense responses are many of the times more than sufficient. These are some selected cases where a proper...
Absolutely, sir. Absolutely, sir. Neeraj, sir?
Yes. Dr. Veer Pillai wants to ask one question.
Yeah, Veer Pillai. Do we have time, sir? Can we take
Yes, no problem. You can go ahead.
Okay.
From my side, I have no problem as far as the time is concerned.
Okay. Dr. Pillai, you can go ahead.
In chat box, there is one question. If Dr. Pillai is not there, you can read out. Apurva?
Yeah.
In chat box, someone asked some question. Dr. Mitali.
Yeah, Dr. Pillai.
Yeah. Thank you.
Thank you. Yeah, please. Yeah, go ahead.
Hello, sir.
Thank you. Wonderful to listen to Dr. Rao. Thank you very much. I just wanted to make one question and one comment. Dr. Rao, how much efforts you are able to put the residents in the graduate level or cultural sensitivity, because in sensate or sex therapy, it is something becoming very challenging, and people who are coming from diverse background, our own residents and trainees and psychologists, how much they are able to feel desensitized when they take up these matters with the couple and then train them in that. And second thing is that in my experience of counseling, psychotherapy, CBT and all that, I find that apart from sex therapy, when you're doing it sensate focus, the judicious combination of couples therapy with communication model, relationship therapy, counseling, supportive therapy, they are all very much important to help the couples in a variety of ways.
I fully agree with the point. But the important point, for example, Manish Mahajan was part of a fellowship program. See, he was doing quite a good job. What actually the training, focus, developing sensitivity brings about is actually certain remarkable qualitative changes. So this is the first point. Many of the times, many people are not able to do it because one thing is there is nobody to train them, and second one, whatever they learn in some of these YouTubes and what we call the so-called sex therapies can be sometimes may not necessarily, and many of the times some shortcut methods people try to make use of. It is not going to work. That is second. The third point is, see, I have seen some of the psychologists. In fact, we have seen some psychologists very commonly combining all these things in a very beautiful way. But some of the things actually a lot of scales and this thing and all that, but again, it all depends on emphasis on what. In fact, there are some couple where the communication is the issue. In some other couple, it may be the intimacy related aspects. In some other individuals, it may be something totally unrelated to the sex.
Correct.
One has to definitely look into what one has to
Correct.
do. That means each case is actually separate, and individualization of things are necessary. The third point, see, we are no more an underdeveloped country or a third world country. In fact, people have money, people have education, people have right of understanding. That means what I want. And couple that old idea that they will chuma oblige everything actually being told, it won't happen that particular nowadays. So it is for those people who are educated, who can afford, and who are motivated to get the changes brought in their life.
Absolutely, absolutely, sir.
Subhasri, is there?
Okay. Thank you so much. Sir, we
Good
can
evening,
take
sir.
the last question. Yeah. Subhasri.
Sir, Dr. Rao, that was a fantastic, yet another fantastic session. This is Subhashri from Chennai.
Oh, beautiful, madam. Please.
Yeah, sir, my question is that, see, many of the couple come for counseling, and seeing them, they come with a problem of mostly relationship issues or something related to clashes, conflicts, difference of opinion. There are so many things may be a problem, and we approach it, but back, and most of the clients give a hint of that, no, there is now, I feel an emptiness, and there is an empty kind of a feeling. And when I hear this particular term, and I eventually got to know that they're having a lot of issues related to intimacy and sexual relationship problem. So I wonder that how could we initially, when can we start this in the couple therapy, initiate about sex and intimacy when it is appropriate actually?
Beautifully arranged. In fact, I can tell you, many of the female clients what we have, in fact, let me tell you, in fact, MD thesis in our department, at least now 5 are related to the female sexuality. That means we are focusing on this particular area significantly because this is hardly spoken and many people don't attend to this. The point is, when intimacy issues are problem, communication issues are problem, and other say alcoholism is the problem, smoking is the problem, we have to attend to some of these type of things in the beginning. It cannot be done. I'll tell you, there may be couples. I had one Marwadi couple. In fact, she says, I don't want to stay with him because he chews pan. He says, I can forego her, but I can't stop chewing pan. No, see, the problem looks so simple. But the whole issue here is actually you have to attend to this particular aspect first. That way, in fact, she feels comfortable with him and he can be comfortable with her. So each of these areas are different issues related to different couple. Now, because everybody is very busy, they can't take time at all. I want IVF and I want to get pregnant, and that is the end of the story. These are all some of the newer things that are happening in cosmopolitan, metropolitan cities and all of that. They are not the clients for our regular sex therapy and various related things at all. So those people who are willing to invest and they feel that life is meant for so many other things other than actually just simple sex or getting pregnant, this is where actually our role comes into the picture. It is a time-consuming process. You need to be having a proper scientific knowledge related to this, and you are not going to make too many shortcuts and all. Extremely important aspects necessary for this.
Yeah, I understand. See, when you are presenting, I could see that how the having a mindful sex is matters actually.
and how they need to be trained. Probably the systematic desensitization could be used for them by experiencing each stimuli, and how you respond to that, and how you are getting associated to that, and how you are sexually aroused with that, and all that. My question is that when I could see that, then there is an it's so sensitive to talk to a couple who are actually very, very
It
close
is not
about
a
their
problem of a couple. It is a problem of we professionals. We don't know
Yeah.
what to talk, how to talk, when to talk, how much to talk. In fact, we don't know. We have not been trained. We want everybody to come forward with their problems, and in very simple way, I should be able to understand. Maybe taking one X-ray or one CT scan or one MRI should solve the problem. That is not going to work that particular. Need to develop how to collect history, how to go about. See, for example, even in our department where we emphasize on sexual aspects so much, when PGs collect a case of depression, they ask about libido, nothing more than that. There is a conversion disorder case, they will ask about any sexual abuse history. That is not the way. There is a multiple histories that need to be collected and looked into. That means a comprehensive understanding of couple is absolutely necessary.
Yeah, I understand this. And I have one more question, doctor, if you have time.
Yes, go ahead, go ahead.
I'm sorry. This is about, and we are talking about couple often. Couple can be defined even in unmarried people who are living together, and people who are actually in courtship also. And I have
couple means a man and woman from our point of
woman,
view.
yeah, even it can be anything also now. So what I really wanted to know is, see, there is an kind of an guilt associated for people who are not being committed into this kind of relationship. I could see that they are able to have, when they are out of this relationship, or they have having a problem in the previous relationship, that has also been carried into this. And while you were explaining in the memory of the first love, memory of this, that is always there. And what is a specific therapeutic technique could be useful for finish that unfinished business of those things, and get into this business?
Of course, Subhashi is a psychologist. She is well aware. There are some people where maybe psychodynamic processes are important. In some other individual, cognitive behavior therapy, maybe we are going to talk about it in the next session. We carry forward many of the misconceptions and ideas related to that. And we are worried about yesterday, and we are worried about tomorrow, and we are spoiling today. In fact, the whole process. That means which school you are going to follow depends upon what is the type of case what you are handling, and what is the type of problem that is involved. There are multiple. See, from Mysore, I have to reach Bangalore. I can go via this super fast expressway, or I can take a little roundabout way from the village side. All ultimately we reach. But it left to the therapist to actually guide to some extent. And second, depends upon the type of clients whom we are handling.
Yeah, nature of the client.
In fact, this is what we call as eclectic form of therapies, in the sense that each case we determine exactly what methodology we need to follow.
Yeah. Thank you, doctor. That was fantastic session.
Apurva, there is some question in chat box from Dr. Mitali.
Yeah.
Mani sir, Apurva.
Mani sir, yes sir. Mani sir, can you take the questions?
In chat box, there is a question from Dr. Mitali.
Hello, sir. Can you hear me?
Oh, yes,
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 you can go ahead. Dr.
Good
Mitali.
evening, doctors. Hi, I'm a sexual medicine practitioner at Ahmedabad, and I recently started practicing actually after training from ESSM. I think Rao sir knows ESSM. So I wanted to ask if you have used sensate focus in patients with vaginismus.
Absolutely. In fact, the pain and penetration disorders are one of the important actually problems for sensate focus. I didn't go into the elaboration of some of these things, but any female sexual dysfunction, sensate focus exercises are extremely useful, those things. And pain and penetration disorders, in fact, part of it now actually, extremely important.
Um,
Yeah,
In fact, this is one of
Sir,
the.
may I ask the other question?
Yes,
If
yes,
that's
sure.
okay?
Yes,
Okay.
yes, sir.
Sir, my other question was that I had a couple. I actually had a woman. She had penetration phobia, and she was very willing for sensate focus. She was very willing for all the counseling and all the discussions that we were doing. But her husband was not ready at all for sensate focus. Especially, he was not ready to entertain the thought of it. So, what do we do in such cases?
Of course, this is one of the. See, for example, if I have seen 10 cases, ultimately one case lands up with the treatment not because of anything, but in our country, for a woman to come out, it is actually difficult. Men actually don't understand because I am getting erection and I am capable and it is your problem, you go and correct it. These are not cases for the sensate focus exercise at all. So both are willing to change, both are willing to contribute, both are willing to, in fact, there are very beautiful videos which can run for almost about 30 to 40 minutes, how to go about. We have, but I am not sure publicly whether we can put it. These are all
Sir,
therapeutically.
you can send that video. We will send with the certificate to everyone.
Sure,
Link.
sure, sir.
Yeah.
There may be copyrighted issues. That is one of
Okay,
the.
okay.
We need to definitely look into that. So, because some of these type of things for the public viewing and all of that issues involved, we need to just a small clarification we need to have. So, the problem is we get definitely couples like that. And one of the reasons why we don't succeed is actually women also give up somewhere in between. Many times men don't cooperate. That is actually the extremely common problem what we encounter.
Yes.
Where both are understanding, both are in love, and both want to change. They are beautiful clients to treat.
Thank you, sir. Thank you so much. Thank you so much for clarifying this. Thank you so much.
Yeah, Dr.
Excellent session.
Yeah. We can
There
take
is no
Ravi's
question in the
Yeah.
chat box as such.
Yeah. Dr. Ravi is,
Yes,
Dr.
sir.
Ravi, go ahead.
Yes,
Yeah.
sir, where we any centers to learn these techniques, sir?
Actually,
About the psychosexual
Yes,
techniques.
Academy of Higher Education and Research. I am extremely happy to say that in our country, this is the only university-based program that is happening. And,
Where it is, sir?
Mysore.
Mysore.
This is medical college. This is and this time
Mysore,
we have
yes,
already
sir.
announced the. I can send this to Dr. Neeraj Saab and he can forward this training program because 20th is the last date. They may expect because we have enough number of applications already. So those who are interested, definitely most welcome.
Any other one want to ask anything?
Apurva also, you can forward it to the different groups.
Yes, sir. I already forwarded, sir. Yeah.
So I think no more question. You can go ahead with the vote of thanks, Apurva.
So what to say about this session, even after 3 hours spending and still more than 80 people are still log in and stick to their screen to learn something new from our faculty, Dr. TSS Rao sir. This is what the beauty of this lecture. So this is a time to say goodbye, but goodbye is just a beginning to say hi to the next session. So my dear friend, I would like to say thanks to the Foxy president, very respected Dr. Rishikesh Pai sir, our Secretary General, Dr. Madhuri Patel ma'am, our Vice President in charge, Dr. Asha Bakshi ma'am, and the person behind all this program, our chairpersons, Dr. Neeraj Jadhav sir, and our wonderful faculty for today and for this whole series, Dr. TSS Rao sir. I would like to thanks to
his videos and all. Is it comfortable actually? Not a problem.
No. It was yeah. We want to learn, so it's perfectly all right.
Perfectly all right. I would like to thanks to the ICOG chairperson, Dr. Lakshmi Srikhande ma'am, and the Secretary General ICOG, Dr. Ashok Kumar sir, for giving us one ICOG credit point. And I would like to thanks to my co-moderator, Dr. Manish Mahajan sir, for moderating this session so well, and to all the viewers for making this webinar a successful one. So we will again come up with the next session with some exciting topic with our own faculty, Dr. TSS Rao sir. So thank you so much.
Apurva and Manish, for wonderful moderating all the session and all the work behind the scene. So Thank you to both of you.
Thank you. It's all the force from you, sir.
At the
Can I
beginning.
say something, Dr. Apurva?
Yes, yes, Doctor.
Yeah, sure,
Yes,
sure,
madam.
ma'am.
Yes,
Ma'am.
madam.
To begin with, hearty congratulations. I was glued for the last couple of hours or more. The other thing is that please ask Dr. Rao sir if there is just some fellowship programs, not complete courses or some, short fellowship programs which people come and do. That would
Ma'am.
be a big help to
Yeah,
practicing
The Rao
gynecology.
sir has already stated. Yeah.
One is certificate program which runs for 6 months. And
Okay.
another one fellowship program for doctors which runs for 1 year.
Oh, I see.
Many of these type of things, what we talk about, one lecture, 2 days program, maybe quite interested people, this may work out, maybe refining some aspects actually.
Aspect. The other thing,
But
Dr.
a
Apurva,
proper control on proceedings and learning something, it is actually a process involved.
yes,
So-
yes, correct. So Dr. Apurva, another request is that all the members who attended today, please send them their attendance certificate.
Yes,
I'm
yes.
very
Yeah,
definitely,
definitely.
we will.
proud of having it.
By mail.
Yeah.
Yeah, it will be sent by mail. And we also shared the recording in the various group. And those who want to get something, we have our Facebook page, Sexual Medicine Committee, Foxy. And we have all the lectures and newsletters which we are published so far. And we have we are all the webinars which we have done with this topic. They can go there and they can get the recording also and learn
Yeah,
from
just give the Facebook address also on the groups. We'll
Yes.
copy it down once and keep it.
Yeah. Sure, sure, ma'am, sure. Thank you so
Thank you.
much. Thank you so much. Thank you.
Thank you.
Thank you.
Thank you.
Thank you very much.
Thank you.